Good morning. I'd like to call this meeting to order and ask the clerk to call the roll.
Supervisor Zaragoza.
Here.
Supervisor Long.
Here.
Supervisor Huber.
Here.
Supervisor Parks. Here. Supervisor Bennett.
Here. Would you please stand for the Pledge of Allegiance with me? Hand over heart. Ready? Begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, we need a motion for the minutes of Friday, June 14th. We got a motion and a second. We're ready to vote.
Chair Bennett, we have two sets of minutes, June 11th and June 12th.
Thank you. Okay. And we're now ready for agenda review, Mr. Powers.
Chair Bennett, board members, item 11, CEO's Office resolution authorizing the county to continue to participate in the Golden State Finance Authority Mortgage Credit Certification Program. Revised board letter was submitted to correct the abbreviation from GFSA to GF. In addition, a revised agenda page 4 to reflect the change in the board letter. Item 23, Healthcare Agency, recommendation to appoint Renee Higgins as regular consumer member of the County of Ventura Community Health Center Board. Revised board letter correcting non-consumer member to consumer member has been submitted. In addition, a revised agenda page 6 to reflect the change in the board letter has been submitted. Item 25, Healthcare Agency, Behavioral Health, authorization for the Behavioral Health Director to sign various amendments to agreements. Request removal from recommendation number 2, the proposed amendment to the agreement with Kepra House. Item 37, Public Works, authorization for the Public Works Agency Director to sign a lease for office space located at 3160, 3170, and 3180 Loma Vista Road, and request the item to be heard before the 10 a.m. certain times. Item 40, Public Works, approval of the acceptance of California Department of Fish and Wildlife Proposition 1, fiscal year 2019-20, and Proposition 68, fiscal year 2018-19, Restoration Grant Program funding for the Santa Ana Bridge replacement. Request to be heard as a regular agenda item. That's item 40. And finally, item 50, Healthcare Agency, BCMC, approval of professional services and operational agreements. A board letter and exhibits 1 through 13 have been submitted.
It's item 55, right?
Item 55, that's right. Thank you.
Board members, any other modifications to the agenda? No. Well, all right, we have a motion and a second to accept the agenda as revised. We're ready to vote. And I'm really happy for us on our moment of inspiration. We have Monique Nolan, Deputy Director of the Area Agency on Aging, and she's here to talk to us about the Home Share Program, which has been a really successful effort here. So good morning, Monique, and thank you for being here for
Good morning, CEO Powers, Chair Bennett, members of the Board of Supervisors. I'm Monique Nolan. I'm the Deputy Director with the Ventura County Area Agency on Aging, and I'm here today to share a moment of inspiration about the Home Share Program. And before I get to the video I want to show you, I want to give some background about the Home Share Program for those that are in the audience that are not familiar with the program or that are listening. So the Home Share Program is a free program that provides assistance matching home providers, primarily seniors, with home seekers who are willing to help with household tasks, transportation, companionship, financial support, or a combination of all of these in exchange for affordable housing. The concept's not new. It started in the 70s, and in 1979, an organization known as Affordable Living for the Aging received a 5-year federal grant to start the first shared housing experience for seniors in Los Angeles. And since that time, and with shifting popularity, Home Share has become a nationwide and international effort. Home Share Ventura County came to us through the visionary leadership of the board in July 2014. Before Home Share Ventura existed, and it was a nonprofit organization that was housed in VC AAA, but not part of VC AAA, and was operating citywide, but not countywide. So in 2014, the program came under the auspices of VC AAA, and we scaled it and made it countywide instead of citywide. We opened it to other ages, and we also provide supportive services to the older adults that come through the program who may not have otherwise darkened our doorstep. So having home share as part of VCU AAA wasn't simply because it was already co-located there. It's because it was the right fit for the services that we provide for the older adults in the community. We have 4 locations. Our flagship location at the Area Agency on Aging across the street at 646 County Square Drive. We have a satellite site at the Simi Valley Senior Center, a satellite site at Office of Supervisor Parks, and we have a satellite site at EP Foster Library. And I'm proud to mention that the EP Foster Library site is solely ran by a volunteer of the Home Share program who has been a volunteer of the program since 2009. That's Ken Finning. I wanted to show the roadmap for housing. I'm not going to go through it, but just to show the board that we really take a holistic approach when looking at the home share program and how it fits with the affordable housing, combating and making sure that we have affordable housing for our older adults, and the homeless efforts that we are part of the combined efforts of the county to mitigate. So you can see there, we think these are questions that we're all going to have to ask ourselves at some point. Can we live independently with some help? Can we live independently? Can we no longer live independently? And you can see that we drilled down and we've highlighted the areas where home share might be an answer. So now to the moment of inspiration, I want to share some feedback that we got from clients from our 2018-19 survey. I appreciate how they tried so hard to help me. Thank you. I so appreciate all you do to help all of us. I brag to others about your services. And Ventura County for Aging is the best in California. I thank God forever we moved to this area where needs of the seniors are not forgotten. And on that note, I'd like to share a video. And if we could start the video.
I wanted a roommate, but I didn't do anything about it because I didn't know how to go about looking for a roommate.
I was looking for senior apartments, and I applied for a senior apartment, but there's a long waiting list.
I walked by the office that says home share, and I thought, I've been meaning to look for a roommate because living alone is getting too lonely.
There was an information sheet on the back that talked about home share, and I thought, you know what? I'm going to call and find out about this. Home share is just excellent.
Run, don't walk to home share because they will help you. They will find somebody that will work with you. You know, they'll find a match. So don't wait. You know, just do it.
So the reason I chose that video, that's Loanne and Kathy. If you heard Kathy say that she had placed herself on the housing list, but it's multiple years long waiting list, and so she was looking for an affordable housing option, so she chose home share, and I'm happy to report that 2 years later, she was in that match for 2 years with Loanne, and she finally came to the top of the list for housing, so she was able to secure senior housing. But that underscores the importance of the home share program. It really served as a safety net for Kathy until she could secure that housing. So I thank the board for its support of the home share program. I thank the board for its support of the Area Agency on Aging as we seek to uncover innovative solutions to address the needs of our community, of our older adults, as we continue to rise and grow exponentially. And I thank you for your time today. Thank you.
Well, thank you very much, Monique. The program is inspirational, and I've had the good fortune of being out with you in the public selling the program, and you are inspirational out there representing Ventura County. So I really appreciate that, and you're absolutely right. The need for this is just going to grow and grow, particularly as we have a real resource here. We have a lot of people in homes that they have excess housing capacity in their home for their needs as their children have gone off and all. And so making the match is a real satisfying piece of work to get to engage in. And so thank you very much for sharing this all with us.
Mr.
Really
Chairman, I
appreciate it.
also want to thank you so much because we have people calling us in my office. We refer them to your office and you help them out. So thank you for the excellent work. Thank you so much.
I'd also like to, it's such a wonderful program, and in addition to it being a way to make ends meet financially, it also helps people who deal with things like isolation.
Yes,
That's such a big
definitely.
thing right now, and I think that is one of the things we'll focus on in our next senior summit, and the idea of having that individual with you that you can talk with and become more socialized, because that's a huge issue right now with the senior population.
Yeah, you heard Loanne say that's why she had come to the program. She was looking for companionship, and since she lost Kathy, she's actually seeking another match with the home share program because she was so happy.
Great,
Thank you.
great.
Thank you very
Thank you.
much.
Thank you so much.
All righty. We are now at our consent agenda, items 11 through 49. We're ready for a motion. Been moved and seconded. We're ready to vote on the consent calendar.
Supervisor Bennett, it is 11 through 36, 38 through 39, 41 through 49. No? 11 through 37. Oh, okay.
All righty. Thank you. And we ready to vote on that? And that's all been approved. And now we're at the public comment portion of this. I have no public comment speakers. Is that correct?
Right.
All right. So we're now ready to go to board comments. Supervisor Zaragoza.
Yeah, thank you, Mr. Chair. I'd like to adjourn in memory of the folks in this list, and also want to share that my assistant Tracy Gallagher and I had the pleasure of attending the Filipino flag-raising Independence Day event over in Oxnard City Hall. It was a 121st anniversary for them. And also, I also attended the 29th annual Juneteenth celebration in Plaza Park in Oxnard. It was well attended, you know. And also, for the record, I just want to share that last night my intent was to vote yes on the adjustment for the budget. I voted but it should have been a yes. So I want to make sure that Leroy and also that the clerk understand that I wanted to vote it yes, and inadvertently I voted no on it. So hit the wrong button for the record. So Leroy, do we have to do anything else with that?
I told Supervisor Zaragoza, we'll look into how we can make that correction, and I'm not quite sure the process, but we'll make sure we'll do
But-
whatever's necessary.
But my intent was to vote yes on that.
We may have to re-agendize for a future meeting just to confirm it or something.
For about a minute or 30
Yes,
seconds.
but just to make it official.
Thank you.
All right.
That's-
Supervisor Long?
Thank you very much. Manny Maharas, my staff and city manager, or city council member, mayor for Fillmore. We went to the Santa Paula Hospital and had a fabulous listening tour with B. Frias. I would like to personally thank her and her staff for walking us through the hospital and showing us all the nuances and wonderful things that are going on there. And I wanted to make sure people know how committed we are to keeping the hospital open. I would like to just state that we are improving operations in Santa Paula Hospital. There's a one-page document in the VC Star, and we're really stepping up our advertising. I'd like to thank Mr. Foley for the commitment of really continuing the care in Santa Clara Valley. The second thing I'd like to talk about is Piru Gateway. I don't know if everyone knows, but we had a ribbon cutting on Saturday. And what is that? The Piru Gateway is 91 units in Piru of homes. We made the investment, our board approved the homes. We have 8 townhomes, 53 single-family homes, and 30 rental units. The Piru Neighborhood Council and all the community came out and just really supported the project, and it was very exciting for this community. So I'd like to just thank the board for the continued support on that project. And lastly, I'd like to talk about the partnership, a unique partnership between Fox Canyon Groundwater Sustainable Agency and United. I'd like to thank Supervisor Bennett, because I know he was on the board for voting this. They purchased 15,000 acre feet of water. And this was, we had a really great opening session on Friday, and what it was doing is we released 800 acre feet a day, which is equivalent to 1,600 households of water used in 1 year. This came from the San Felicia Dam in Lake Piru into the Santa Clara River that started on June 3rd. This is the effort to replenish the aquifers in the Oxnard Plains, prevent seawater intrusion, and dilute the nitrate levels of local wells. A portion of the water made its way to the United Waters Freeman Diversion, where it was redirected to the Satakoy recharge basins. And so the water release was made possible through this partnership. And it's an exciting time because it's not just working in silos for water. It's important that we put these puzzle pieces together and work together for the good of the community. So I'd like to thank Supervisor Bennett and all those that are a part of it, because what this is doing is helping to dilute the water so that the nitrates in Oxnard for drinking water is so important.
That's right.
And then it's also going to Camarillo for the Pleasant Valley Water District there, and also in the Fox Canyon aquifers. We've had many people come to this board talking about water quality. And I just wanted to make sure that everyone knows that this is going on. It was covered also again in the U.S. VC Star and so forth. So I just want to make sure we celebrate the good things that are going on in our district to ensure that our aquifers are good drinking water. That's so important to us.
And hopefully it'll reduce the nitrates over in El Rio for the Vineyard Water Mutual.
Yes.
Hoping that'll bring it down to.
Yes, and this is not a new type of thinking. As I was talking to people, and it's generation after generation that has been looking after our aquifers, and their big key is dilution.
That's right.
It's making sure we don't overdraw, making sure that we have enough water so that you don't have the problems that we're having currently for Oxnard. So I just want to say thank you very much. And then I'm going to adjourn in the memory of those on this list. Thank you.
Supervisor Huber.
Yes, thank you. Wanted to welcome the new executive director of the Samaritan Center in Simi Valley. Her name is Chantel Zimmerman. She has an extensive background in community outreach and implemented several support programs for foster youth and disenfranchised veterans. She has some big shoes to fill, but I know she will be a great fit at the Samaritan Center in Simi Valley. Betty Iske did a great job all those years. I'd like to adjourn in memory of the people on the list that I've given to the clerk of the board. Thank you.
Supervisor Parks.
Thank you, and that is great work on behalf of trying to dilute the aquifers to reduce the nitrates. I know we have that same issue in the Santa Rosa Valley, but not necessarily the water source to do the dilution. So a lot of the emphasis also has to be on reducing the nitrates from getting into the water source to begin with, and sometimes that's horse manure, for example. I want to extend our congratulations to Ricky Mickelson. She was selected as the Thousand Oaks Senior of the Year, and she's also our appointment to our county's Cultural Heritage Board. And there were some pretty heavyweight nominees: Cynthia Bell, Gail Field, Chuck Huffer, who's on the Caneo Recreation and Park District, and Patricia Jones, a major outstanding volunteer in our community, and Stacy Simrall. So congratulations to Ricky. And then also I was able on Friday to attend a workshop by the Climate Resolve on wildfire, what cities can do. And I didn't realize it, but our county was also selected as a winner of an award for funding and support services to help develop what they're referring to as a data hub to help us to be more resilient. And that data hub will help to provide better communication. That's one of the emphasis, both to our emergency first responders, but also to our public and what we can do better across our county, and then perhaps that will help statewide. In the workshop, there was a few hundred people there, and it was pretty nice, and maybe Dustin can pass this on to Chief Lorenzen, but Chief Osby, who's the fire chief for Los Angeles County, said when the Woolsey fire hit, he said he told about all these really important things you need to have in place. And one of the things he said is someone you can talk to, someone you can go to, And who was that person was Chief Lorenzen, that he could pick up the phone. We had the experience of the Thomas Fire, and that I just thought was an incredible compliment to our county fire chief. I also ask that we close in honor of the people on this list, and that concludes my comments.
Thank you, Supervisor Parks. There's two items. One, appreciate Supervisor Long's comments about the water. And just for the benefit of the board, because I think that we may need the board support on this, and that is, we had a very, very narrow window, just a few days to make the decision whether to spend millions of dollars to buy that. And so Fox Canyon took it out of its reserves and drained the reserves almost down to nothing. And with the idea that what we would do is we'd be putting in a pump charge for all the people that are pumping water. And that's the appropriate role with the new Groundwater Sustainability Agency, that we are not just regulating demand, but we're trying to actually increase supply. That pump charge is probably going to be about $5 an acre foot, which pales by comparison to what we would have to charge in terms of pump charges to normally buy state water at $1,500 an acre foot, because we were able to buy it at $200 an acre foot. So I think the interesting question will be whether, when we come up with this $5 an acre foot charge now to reimburse this expenditure that we made, whether the pushback will come that people don't want to actually pay for the water, and that would really be short-sighted because this was the cheapest water you could possibly buy to get into Ventura County at $200 an acre foot, and it would be short-sighted to have the people who pump the water out of the aquifer say, oh, we don't want to pay even a $5 acre foot charge to be able to accumulate that water here. The only other item I just want to mention is that I will this afternoon go to an effort, a coordination effort of all the major funders for Matilahaw Dam. The project is still moving forward in terms of the removal of that dam, and we have some very good momentum. We recently got from the California Department of Fish and Game a $13 million grant, which has really infused new energy and new momentum into the Matilahaw Dam removal project. So I'm looking forward to going to that meeting this afternoon, and hopefully someday the county will be able to celebrate the removal of that dam and the Ventura River back to being a completely natural river, and the restoration of all that great habitat up there for everybody. So thank you all very much for those comments, and Mr. Powers.
Thank you, Chair Bennett, board members. Just one comment. I want to recognize Kay Mand, our county CFO. That was her first budget yesterday that she steered through. She did a great job along with her budget analyst. Yeah, Kay's not here, so that, all right. Yeah, along with her analyst team and, of course, all the fiscal officers for the county departments. A lot of moving parts, of course, but what I love, too, is that she spent half her time talking about what she wanted to improve for next year. So that's how she rolls. So anyway, she did a great job. Thank you.
I hope they'll budget more baked beans for the meal. Right? Okay, great. You did a good job on the cookies. Now more baked beans, right? I saw some people got shortchanged on that, right? All righty. We have nothing else. How about we jump to item 54, the healthcare agency? Yes.
Item 51, after that, I'd like to come back to item 51.
Okay, item 51 is a 10 o'clock time certain.
Right.
Okay,
Oh,
so
is it?
we will.
Oh, okay.
Yeah, so we'll have to wait until 10 o'clock before
Okay,
we're able to do
good,
that, Mr.
thanks.
Huber. All right, so item 54, healthcare agency.
Let me see.
Good morning, Ms. Johnson.
Good morning. Thank you, Chair Bennett, supervisors, and CEO Powers. I stand before you today to request your authority and authorization to go into contract for $14.7 million with Traditions Behavioral Health to provide psychiatry services for our consumers. As you know, the Behavioral Health Department is designated to and required by Department of Healthcare Services to provide psychiatry services to those with severe and persistent mental illness and the Medi-Cal population. We currently have a contract that will expire June 30th, 2019, and this new provider would start July 1st, 2019. Because we do have final rule that was implemented July 1st of 2017, we have access, timeliness, and compliance standards that we must meet in order to avoid sanctions. And so built into this contract are metrics that would require compliance and for timely access, network adequacy, and also productivity to ensure that we are able to meet these guidelines as set forth by the state. I'm available for any questions you might have.
Thank you very much. Do we have any questions?
No, I just wanted to say thank you to acting so quickly on this. It could have cost the county a lot more. And patient care is extremely important in trying to make sure that we have my tongue is so tired today. Good doctors that can really provide the service and still be saving our county. So thank you very much.
Supervisor Parks.
I'd second that.
All the jumble?
Yes, without that part. No, it is good that it's cost savings, it's quality individuals, so appreciate the work for that.
Thank you for your support.
In the midst, we've said a number of times here, but the healthcare system's broken in this country, and you have to keep hustling to deal with all of the adjustments and changes, et cetera. And this was an example of really hustling, so thank you very much. Really appreciate it. All right, we're ready to vote on this item. And we're at item 55, Healthcare Agency, Ventura County Medical Center. Good morning, Mr. Foley. Did you just sleep here, or?
Yes, I did, actually, in the back of the room. Good morning. Bill Foley, Director of the Healthcare Agency. Dr. Fankhauser is going to join me for this item. I thought it was going to be later on in the agenda. But first of all, this item covers our new agreements with the professional services and operations. These are the professional services and operations agreements, the PSOAs, which cover our affiliated clinics, and we have 18 FQHC clinics covered by these agreements. In addition, we also have the Anacapa clinic, which is also included in this recommendation. First of all, I want to apologize for the lateness of receiving the material. There have been ongoing negotiations with the medical directors that operate these clinics over the past several months. And but that's not an excuse. We should have gotten this information to you sooner, and we do apologize for that. This is an important part of our initiatives for fiscal year 1920. As I reported yesterday, we now have $44 million in budget initiatives to address the projected loss for next year, including the projected current fiscal year loss of $19 million plus the additional increases in expenses for next year. And $13 million is what we have targeted in our budget with these revised agreements. And that's a combination of reduced compensation to the PSOA holders, as well as increase in productivity. The components of these agreements include the base compensation, which is being adjusted, and the base compensation is a base payment based on standard industry compensation, and supports the support staff and other overhead costs necessary to operate the clinics. There's also an additional, in some cases, additional overhead to allow for extraordinary expenses, which are services that the clinics provide to the community above and beyond the requirements of a standard outpatient primary care clinic. Examples of such extraordinary services would include perinatal services, diabetes management, wound care, and expanded support for social services. The second component is provider productivity, where we are paying it's a payment per visit based on MGMA median for provider productivity. MGMA is a standard criteria that measures physician productivity. For the primary care physicians, we are targeting 17 to 18 visits per day, and that is significantly higher than what it has been in the past. I'm happy to say that since we've negotiated or have been negotiating these agreements, that we have seen an increase in productivity at most of the clinics, and that is reflected in our volumes of the clinics for this year. And then the third component is quality, and up to 5% of provider productivity can be earned by meeting the quality metrics. There are 9 metrics that are measured. The metrics are tied to meaningful use, prime, the quality indicators, and are very specific measures of quality. And then the fourth component is the medical director compensation. And those are, the compensation is based on very specific duties and responsibilities for the medical directors. If Dr. Fankhauser is here, I would want Dr. Fankhauser, who has been very involved in the negotiations of these agreements, to say a few words about the scope of the agreements, and specifically what has been negotiated with the clinic holders, and also wanted to talk about those agreements that are being that we're requesting be approved for this next fiscal year. There's 9 of the 13 agreements that we are requesting approval to allow us to execute for the entirety of this upcoming fiscal year. And then there are a few extensions that we're requesting, and we'll get into why we are requesting extensions in the case of the remaining agreements. John?
Dr. Frankhauser, as you're coming up, I have a general question I think is probably going to fit right into, so if you work it into your presentation, great. But I'm curious about the 9 quality metrics. I know we're going to be trying to increase productivity, and I want to be concerned that we also we're going to be keeping that quality in good space, and particularly access, people's ability to get in and get in quickly and be seen. If the number one thing that we hear about is people just calling and saying, I can't get in, fast enough and stuff. So if you can address that as you're going through elements of this contract in your presentation, I'd appreciate it.
That's helpful.
Also, if I would appreciate also some understanding of the satisfaction of the patients, if we're going to be measuring that, because we can probably make it super efficient, but we want to make sure that the patient's care isn't compromised and that we have, that their, complaints have gone down or satisfaction has increased or whatever. Thanks.
Thank you.
So just do it all. That's what we're looking for here, right? Yeah.
So, Mr. Powers, Chairman Bennett, and members of the board, I appreciate the chance to
Could you pull the
speak
microphone
about
up
this.
just a little bit, John? Yeah.
I'm not much taller than Mr. Foley.
He bends over more than you do, right? Yeah.
So, I just want to reflect that this is the result of a tremendous amount of work and a cooperative negotiation. As you know, that this is a dramatic shift from the previous agreements that we've had with this group of PSOA holders. But the clinicians in these clinics are clinicians that would make you proud. I mean, these are people that me and my family choose to go to, and people that provide truly extraordinary care, and through kind of their approach to this really represented a partnership with the county, and I think they recognize the need to be part of the efforts towards stewardship of public funds, and this process certainly fits into that. I think what Mr. Foley summarized, I don't have a lot to add to that except to say that this is a giant shift, and it really creates alignments of our goals. I think we're looking for fiscal health, and we need a system that's viable well into the future, and this really allows our goals to align with the goals in the contractor's agreement. And I think that the incentives of quality, access, and efficiency are really well designed in this new model. I think that as we see a need to see more patients to provide access, this also incentivizes the contract holders to provide that access. And I wanted to just address the questions regarding quality, access, and the patient satisfaction. And it's just interesting to look at the quality measures. So these are quality measures that fit into what we consider the at-risk quality measures, ones in which we're challenged to meet these. These are not the slam dunk quality measures that are associated with funds that come into the county, but these are the ones that we struggle to meet. And as you know, the thresholds each year are getting higher and higher and higher. So it really makes sense for us to make sure that our partners are in alignment. In this group of quality measures, it includes behavioral health measures. It includes the response of adolescents and adults to depression treatment, and both response and remission of depression. It includes CG CAPS, which is what Supervisor Parks was referring to. This is the patient's assessment of their health care providers and service providers. And the CG CAPS scores are our clinic scores for patient satisfaction. We have the equivalent in the hospital, the HCAP scores. The CG CAP scores are included in that 9 metrics for quality. The other things like influenza immunization, adhering to guidelines for children's immunizations, controlling high blood pressure, and using the electronic health record to communicate back and forth with patients, medication reconciliation, and then the access is really, the quality measure that's associated with access is really specifically in our child and adolescent age group. And those are measures that basically identify those patients with whom we're given the care of, and to make sure that those children are seeing their providers on an annual basis. And that's a metric that we have money associated with at the state level, and that as clinicians we all agree is something valuable and important for our community. So those are just a glimpse of the metrics that we're using and why we chose those metrics. But they do, I think, align with what we're tasked with as public stewards, which is really providing access, providing it in an efficient manner, and providing it in a way that that our patients feel well cared for.
Could you, I have two questions. One, could you contrast the quality measures in this contract with the quality measures in the previous contracts that we had with the clinics? What was in the old versus what is in the new?
So we did have some quality measures in the old contract. This expands it significantly, and it about quadruples the amount of money associated with the quality measures. So our sense is that this, it's specifically quality metrics that we have difficult time reaching. We call them our at-risk metrics. So we've really made the shift to metrics that are ones that are challenging to meet, and then we've increased the amount of the dollar value of meeting those metrics.
Do you have on the top of your head what those old quality metrics were?
I'm sorry, I don't
focused on the
have
new
those.
ones. And then in terms of number of patients, you know, Mr. Foley mentioned we're going to try to shoot for 17 or 18, I believe. And do we know what the what's Kaiser requiring of their doctors? What are the other systems requiring of their doctors?
Sure, there's a few metrics that go into this. Mr. Foley mentioned the MGMA, the Medical Group Management Association, and that's the largest database of numbers that we have. And that our expectation is that if providers are receiving an MGMA average salary, they see an MGMA average number of patients. This also provides an incentive for those who are more productive and for those who are capable of seeing more patients or extending their hours, that there is the opportunity then for them to have income commensurate with their additional efforts. And I think that the comparison with Kaiser is really less valuable to us than the comparison with the community norms, because there are differences. I think you recognize that we care for a population that has a higher need for social services, has a higher need for translation services, has a more difficult time coming in, and I don't say all of our patients, of course, that kind of a generalization would be silly, but
a higher percentage
certainly
than
for the
Kaiser.
number of patients that we have that are that require more time and more effort, the industry standard norms are probably a better benchmark. The other thing that this model is based on, just is really a staffing standard. And that staffing standard is the California FQHC staffing standard, and that's the set of California clinics that are really providing care to the most vulnerable.
And was there a standard in the old contract in terms of number of patients? And if there was, what do we know what it is, what it was?
There was not. So I think that we've seen that there has been, some areas in which there has been some drift from what feels like good stewardship, and I think that this contract brings us back into a position where we feel like we're carefully utilizing public funds to do the care that we're charged with.
That's a pretty instructive fact that there was not one of those standards in the old contract.
I think that in the previous contract, the standards were set by the medical directors themselves. So some of the medical directors did have standards, and some of the medical directors did have explicit expectations, but this normalizes it across the system, and I think it provides a kind of some more central control from
Okay, those are my questions. Thank you very much. Appreciate it.
John,
Mr. Foley?
The average, what was the average before in the past?
If you don't hold me to this number, I believe the average was in the 14 to 15 range. So this
So
will
significant
to
increase,
a
right?
more
Great.
normal range.
Yes.
Thank you. Any other questions?
We have a list of
We have a list.
speakers right here.
We are being,
Kelly and
Oh,
then
there we go.
we are being respectful and letting you speak, and then we're just waiting in line.
Supervisor Long?
Thank you very much. I just want to make sure that the board knows this oversight committee for the hospital system has been extremely diving into these type of questions. Customer service, making sure people have the care that they need, talking about what type of optimization that we need to update. Part of this is the contracts, and I really appreciate that. And I know that we're also working with them on the call system, referrals, and so forth. So not only are the clinics agreeing on this contract, but they're also agreeing with our updating of the systems and the checks and balances and so forth that we need to do. So it's a partnership, I would suggest, because they're saying that they're going to step up their game, and we will have to deliver ours. And if we don't, I think this won't be as successful as we want it to be.
Yes.
So,
Yeah, I was going to say, fixing the access issue is really on us. In order for our providers to see more patients, we've got to address the access issues. And we are currently working on that. We brought in some resources to look at the whole referral scheduling process with the goal of centralizing and standardizing scheduling so that we can fix that because we've got to fix that.
right, and then also we discussed about customer satisfaction. You know, when you leave that clinic, getting a survey or something that you push that button and it's automatic, because I think what happens is with any company, any business, if you don't hear that customer service feedback quickly, how do you change? And so I think it's part of the buy-in for our patients as well to kind of say, okay, they are changing. They are making it better customer service for me to get access to my doctor. Because I think that's really where we need to improve, because our doctors are providing excellent service. And I want to thank them for the commitment to our community. And I think that there's a lot of moving parts and we need to work hand in hand. I just got an email just a second ago talking about the Santa Paula Hospital. And so again, it's clinics, but it's also the hospitals too, and it's a lot of moving parts. But I appreciate your commitment to bringing this up. And in the end, I have another question.
Yeah, this is definitely the culmination of things that we've been pushing for, and it's great to see it being brought forward. And I know we have some really well-performing clinics and others that we can bring up to that, and we're working with them and bring them on at the speed that they can handle. And as Supervisor Long was saying, yeah, probably one of the main satisfaction surveys is whether you can get access. You know, that's a frustration. It takes you months to get in, so I'm glad that that's being addressed. A question that I had, it was interesting to hear that one of the 9 metrics is specific to youth, children, and seeing that they come in, but we know that the biggest users of our healthcare system are older adults. And I'm just thinking in the future, if we can come up with something that can work to see that they can get that access. Sometimes, for example, I love that patients will be able to get their health records, but maybe that's something too complicated or difficult to get for seniors, that maybe there's a phone number they can call and it basically reads whatever that health record says, or some ways that we can, really work to serve the senior citizens and that they can get the information that they need and that they can get access into the system. And I know it's a much challenging group. Their medications are a huge complication because they're on so many things and there's lots of things that they can get. So it would be good to have some metrics for senior citizens too.
Mr. Chair, Bill and the doctor, thank you so much. I think I heard you say that there's going to be an incentive also for the doctors if they go beyond a certain amount of patients. Is that how it's going to work, more or less?
Yes.
And And I get a lot of calls, and also some of my staff uses the doctors, and the quality is there, and the services, it's the access, I think, is a problem. And that's a big issue that we're working on. I think it's really important. And it was shared too if I take my car over to Lexus or I go over to Quest for blood tests, the first thing maybe a minute later, they send a little survey. How do we do it? Do we do great? Do we do good? Can you share information to us? And I think that's basically what you're talking about. Is how can we convey that information to our doctors to make sure that we're providing the service that our users want and need, So, but access I think, is key. If we can solve that, because we have an excellent, health system that I think can really need that help with the accesses, and you're working on that.
Yes.
So thank you.
Thank you.
Well, thank you for all the hard work on these contracts. I know we were trying to hurry to get everything done before the fiscal year began. You were going to mention about 4 contracts that are coming late, and you wanted to say something about that. Could you?
Yeah, I just wanted to clarify that the number 1 recommendation in the board letter covers the 9 agreements that we are recommending be approved for this next year, and it would cover the whole year. There are some clinics that where we are requesting extensions, and wanted to explain why. Santa Paula West and Santa Paula Hospital Clinic, we have a new medical director, Dr. Connell Davis, and we want to give her time to really get in there and get things in order. So we're recommending an extension of the current contract through December 31. And with the Fillmore Medical Clinic, Dr. John Ippolito is a new medical director, and for the same reason, to allow him time to get settled. And West Ventura Medical Clinic, Dr. Paulo Carvalho, to September 30th of 2019, an extension through September for the same reason. The Anacapa Surgical Clinic, we're doing a realignment of services, so we're requesting an extension through December 31 to allow that to occur. So those would be the extensions that are in the board letter, in addition to the 9 that we're requesting for the entire year.
Great.
But there's an
Thank you very
amendment to change the date of Santa Paula Hospital and Clinic to December 31st, 19. So that would be
Yes.
an amendment to the motion.
Yeah, the
Make
board,
sure that we include
yeah,
it, because I don't want you to come back.
the board letter
Well,
says September 30th, and then it was
extension
changed, and then it was
covers
amended to
Santa
December
Paula
31st.
West
Yes.
and Santa Paula Hospital Clinic.
Great.
Yes.
Yes.
All right.
I just want to make sure that was clear.
Right.
All right.
Mr. Chair, can I build one other thing, Doctor? If we increase the amount of patients that the doctors are going to see, let's make sure that the service continues to be a service, not hurry up and see patients just to increase the amount of patients that we're going to see.
Yes.
I think that's important, that quality of service continues, even though we're going to increase the amount of patients that they're going to see.
Yes, absolutely.
Yeah, thank you.
Thank you.
All right. Mr. Powers, you look like you're.
Just lastly, again, these are part of the necessary changes. Appreciate the good work and then the partnership of our clinic directors, which you can see both in terms of the increased visits already happening and those who are stepping up to take on additional clinic oversight. So, thank you.
Thank you.
Any other comments? All right, we're ready to vote. We have a motion and a second.
Thank you.
Go forth and do good work. All righty. Thank you very much for that. And that is item 55. Item 56, Supervisor Parks.
Yes, I'd ask that the Board of Supervisors approve Chad Scott, PhD and an advocate for diversity and transit, and I think he'd be an excellent addition to our Transportation Advisory Committee of the Ventura County Transportation Commission.
It's been moved and seconded. We're ready to vote.
Do we still have one more position to fill? Okay, thank you.
All right, and we have item 57, CEO's office.
All right. Good morning, Chairman Bennett, Board of Supervisors, and Mr. Powers. I'm James Importante, Management Analyst with the County Executive Office, providing notification for the automatic 50-cent adjustment to the living wage ordinance wage rate. Effective July 1st, the wage rate will be $11 per hour for workers that receive health benefits and $13 per hour for workers that do not receive health benefits. Just some brief background on the ordinance. The living wage ordinance was adopted by your board in 2001 with the purpose of alleviating strain on county services as a major health and social services provider in the area, and to promote within the region an acceptable living standard for working residents. The living wage ordinance applies to certain county service contracts above $25,000, as well as county employees. And the wage rate is calculated annually by CEO using December CPIW and adjusted when those cumulative increases reach 50 cents. So this adjustment is automatic unless the CEO finds it to be a burden on the budget, which we confirm it does not. So, just a few items to note. As I mentioned earlier, the living wage ordinance adjustment is based on CPI and is not pegged to the state minimum wage. So it's on its own track, so to speak. So state minimum wage, as you know, will be increasing $1 at the start of each calendar year until it reaches $15 per hour in 2023. And compared to the rate of change for the CPIW experienced in the last several years, it's likely that the living wage ordinance wage rate will be exceeded by the state minimum wage. So your board may want to consider updates to the ordinance in the future. In the meantime, the CEO's office will administer the program per the ordinance. So with that, if there are any questions, that concludes my presentation.
Don't have any questions. Back in 2001 when we did this, there was some real concern that this was going to really be too much of a budget hardship on the county, and it's obviously looking at our fiscal situation, it has not been, and it's certainly was an improvement at the time for some of our lower income workers here at the county. So thank you very much. We have a motion and a second. We're ready to vote.
I just want to say thank you for a very good presentation. Appreciate it.
Thank you.
And I would just say, too, it does make a difference. You know, it is from both ends. Things are a little more expensive, but we are helping people who need the funds most.
All right. That motion passes unanimously. We're at item 58, approval year-end budget adjustments and carryover loan. And this will require a 4/5 vote. Good morning, Ms. Mann, and congratulations again for getting your budget done yesterday.
Seems like I was just here.
All right.
It's K-Man, CEO's office. The item before you is the approval of a number of year-end budget adjustments, along with the carryover of loan for VCMC from FY19 into FY20, as well as receiving the semi-annual report of grant activities. There are 5 budget adjustments, including one for RMA. We had your board had set aside $4 million sometime back for the RMA for the general plan update, and so they've expended $581,000 so far, and so they are requesting appropriations for that. Currently, there's $1.2 million left, and so there's also some adjustments for revenue for behavioral health, alcohol and drug program, for sheriff's reimbursement, and there is also an adjustment for the P-tax project, as well as for the fire department. They've incurred some expenditures related to the Hill and Woolsey fires, and they need appropriations. However, they cannot accrue the revenue until, let's see, FEMA actually obligates the funds, and FEMA won't be doing that until after year end, or rather fiscal year end, and so temporarily they must use their fund balance in order to be able to get the appropriations. But as soon as the funds are obligated by FEMA, which should be in the next fiscal year, in the next it's a couple of months, they will be able to take the money back to fund balance and out of the revenue. So, and aside from that, there is the year-end interfund loan. It's a maximum not to exceed amount of $135 million. They may need, or rather, they may not need the full 135. It all just depends on what kinds of revenues they can receive before fiscal year end from the state. And the last is just to present our semi-annual report for grants for acceptance by the board, for grants that were approved administratively during the year.
Mr. Powers.
Thank you. If I may, I'd like to ask Mr. Foley to come up and speak to the loan, please.
We have one public speaker on this item when we finish with staff.
Yes, I've also asked Carla Valet to join me, our CFO. So we have a $125 million loan to the health system from the county. We have been tracking very closely the amount of funds that owe to us by the state Department of Healthcare Services, and we have been actively engaged in discussions with the state. Mr. Powers has met with the Department of Finance, Department of Healthcare Services. We've had several phone calls with the Department of Healthcare Services, as well as meetings with Gold Coast, because some of this funding comes through Gold Coast. In total, we are due $200 million from the state and the feds, and approximately 90 million of that flows through Gold Coast. The approach we have taken is that we know that the money is due us. We are asking if, even if Gold Coast has not received the funds from the state, would they give us an advance? And those have been the discussions that we've had over the last few weeks with Gold Coast. Just to give you an idea, we expect this year, fiscal year 18-19, to receive $9.5 million in total of the $200 million. And according to our numbers, which we verified with the California Association of Public Hospitals, CAPH, $135 million expected to be received next fiscal year. So this is why we're working so hard to try to get at least some payment, and because you know, we are confident that we're going to pay off the loan when we receive these funds. And Carla, would you like to add to that in your discussions with Gold Coast?
Sure. Good morning, everyone. Good morning, Mr. Powers, Board of Supervisors. My name is Carla Valle. I'm the Healthcare Agency CFO. We've been in active discussions with Gold Coast to receive the funds that are due to us. We, as you know, we take the risk for managing this population. And so all that we're asking for is for the money that's coming to us to get to us sooner rather than later. The half of the $90 million that Gold Coast owes us should be due to us in October. So we're just asking for that to come sooner. We're also in active discussions, as Mr. Foley mentioned, with the state and with active partnership with the public Hospital Association to help us with those funds. We have about 10 years worth of receivables that are due to us, a lot of it being stuck in the state. While that's collecting interest, we owe the county money. So we want to make sure that we get all that to us. We know that we should expect at least probably 30 million of that, hopefully in the first 2 quarters of the year coming. So we were on the phone just yesterday with the state to try to understand how quickly we'll get that. And so we're in active discussions to hopefully get that due to us. And the intention at the end of the day is to pay off our loan and just not owe the county money. Yeah.
Thank you. I was just hoping that perhaps we can get a timeline. I know it's hard when people owe, what do we do? But I think that it's important to set goals as to markers when we can get this paid off.
Yeah, you and me both. We were trying to get the state to give us a specific month. They were only able to commit the first 2 quarters to get some of that funding. The bigger problem is that the money that's due to us is stuck with other healthcare systems. So it's not specific to us. And so those audits now are complete, and it's just a matter of getting the money from the counties that were overpaid and giving that to us.
Mr. Chair, Carla, the advance from Gold Coast, what's the timeline on that? Are we working on it now, or what?
We are from many avenues. It's been a challenging conversation, but October, our money will come from the state to us, and all that we are asking, it isn't even a loan. This is money that's due to us.
Give us an advance,
earlier,
subject to that money coming in.
Correct.
Good, okay.
Mr. Powers?
Well, thank you. Bill and Carla, our approach with the state, Department of Finance, Department of Health Services has been, the system has provided the services, didn't delay the care, provided excellent service, put out the money, took the risk, hired the staff, and yet the system and now the county is left to bear the burden of this cash flow shortage, which we feel is unfair. That's the message we've sent. It seems to be well received by the state, but now we need to turn that good reaction into the flow of dollars. We did get a letter from the state, as you know, that said we're going to get some of the money this fiscal year. Most of it will be next year, and they are working on it to finalize a timeline, to your point, and they're going to let us know when they get that. We've been in close and regular contact with our auditor, Jeff Berg, as well as the taxpayers group about this, because we are all concerned about this, and we need to all collectively work to get, frankly, the system and the county what it's owed. Thank you.
Anybody else? All right, we have David Grau, a public speaker. You didn't draw the same size audience as last night, Mr. Grau.
It was a lot more boring. This is numbers. Thank you, Dave Grau, Taxpayer Association. We've been meeting with Mr. Foley and his staff. We've tried to raise this issue of the loan, and possibly naively, some of this is raised because of our, observations. When you look at this, the loan that's structured by the board carries no interest, does not require repayment, does not need really a justification for the need for the loan, other than they have cash flow problems. No lending agency in the world would offer loans with those terms. 18 months ago, the former county CFO told us the loan, which at the time stood at $65 million, and we were a little alarmed by that, would be paid down to $15 million by fiscal year 1920. Instead, the loan grew to $125 million. This is not a new problem, the late collections from the state. It's been around for a while, so I don't think we should really focus on that as the problem. Basically, the loan is made up of 2 components. When the hospital loses money, when it bills less than it pays out in expenses, whether payroll or whatever, it borrows from the general fund. If it's unable to collect its invoices from the state, like Mr. Foley was talking about, it borrows the difference interest-free from the general fund. What we had been calling for, what we're calling for today, and it sounds like Mr. Foley's doing that, is a plan, a repayment plan. We can't just year after year say, well, we're going to give you $135,000 or $135 million with no repayment expectations. I think the budget process was a really good start, but I think as part of the budget process, the loan repayment, addressing that should be part of the budget process. You know, you have two financial statements when you put together a budget, an income statement, which the budget addressed last night, and a balance sheet, which is not addressed. And the biggest item on the balance sheet is that loan. And I think as part of the board's obligation, they should require more from the agency. As far as I know, this is the only agency that gets to borrow $135 million, no questions asked. You know, last night you guys were talking about a homeless shelter trying to come up with some money. Now we're talking about a lot of money. So I think from our perspective, I think, you know, Mr. Foley and the CFO for the hospital is on the right step or on the right path. Supervisor Long says, why don't we have actually a repayment schedule? I think that's a very reasonable request. Any lending agency would require that. And that's what we request, and thank you very much.
All right. Supervisor Parks?
Can we charge the state interest on the money they owe us? I like this whole concept of interest now. That
Right?
you know, government agencies can all of a sudden start charging each other interest.
You could earn some real money doing that. Legally, probably not, but equitably, certainly worth asking for, definitely.
I just want to point out that, as we've said over and over again, the healthcare system in this country is broken. To try to be able to make it work at the county level is the art of the business here, to try to make sure that we can actually provide good health care and we can be fiscally sound at the same time. It is perfectly appropriate that if the state doesn't pay our healthcare system for providing the service, that we have to cover that. But to suggest that the healthcare system has to make enough profit to be able to cover $200 million of late payments by the state is, I just think, completely unrealistic. You can't put that burden. We already have a burden on them. Right? They've got to make the system fiscally sound, assuming they're going to get paid. To turn around and then say, now you also have to make enough profit to pay back when the state doesn't do that. So I think it's, I'll disagree with the presentation that this isn't new, and therefore the healthcare agency alone is responsible for it. Being paid late by the state isn't new. But to say the healthcare agency has to suffer that without the reserves that we have, without the financing authority and ability of the county would be just preposterous, I think, in terms of doing that. So yes, we need to be diligent. We need to pay attention to the loan. We need to pressure the state constantly. But the charge to the healthcare agency is to run that system fiscally responsible, make sure revenues match expenses. When the state doesn't actually give us the revenues, when they match revenues with expenses, which we've done most of the years, if you look at our income sheets, most of the years we've done that, then when they do it and the state doesn't pay them, then I think that's when the county has to step up and provide the loan. Supervisor Long.
Yes, I take the conversation a little bit differently. I think we really do need to make sure we're watching the loan amount, and we need to be a little alarmed when it goes larger than it has in the past. And we have that ebb and flow, and I appreciate the catch and balances for this, but it's also the responsibility of this board to make sure that those loans do not become unmanageable. Like a credit card payment, we always have to pay our payment down. And so I appreciate that the board is here to provide that loan for the hospital for the flexibility. But we also, as a board, have to be managing the dollars for our community and just to make sure that we do watch that line and make sure that it is only at a manageable. So I think that's where I take it. I don't think that, I just want to make sure we're confirming on that.
Well, I don't think anybody disagrees that we should watch that loan carefully. It should be important. The question is, what do we do when the loan is at $135 million and the state owes us $200 million? Do we turn to the healthcare agency and say, you've got to pay us that right now? Or do we, so yes, it's important. Yes, we should pay attention to it. The question is, do we throw that burden on the healthcare agency? And that's what I think is not appropriate, right?
And that we also agree that we did have an accelerated in debt. And as a result of that, we're in the situation we are. So we have to make sure and hold and just what we approved at our last agenda item, make sure that that doesn't continue to grow.
Sir, I think it's very important for us to say the healthcare agency can't continue to run deficits. A $48 million deficit, and Mr. Foley and his team are on it in terms of trying to bring that down. They can't run ongoing deficits. But if they run a balanced budget, if they'd run a balanced budget every year, we would still have to lend them this money from the state. That's what we have to recognize, right?
And Mr. Chair, we need to continue to work with the state to make sure that we're funded accordingly. I mean, if there was $200 million, I mean, that's a tremendous amount of dollars that is owed to us, so we need to continue working with that to work with the healthcare agency.
All right, we have a motion and a second. If there are no other comments, we're ready to vote. Thank you.
Thank you very much.
No. All righty. And we are about 6 minutes before our time certain. I think we have item 50. We have we've already had board comments, right?
No, correspondence? 61?
We have, I'm sorry, we have 59 that we still need to cover. Good morning, Mr. Bravo.
Good morning, Chair Bennett, members of the board, Mr. Powers, Robert Bravo from the County Executive Office. Today, we are requesting a change in administrative reporting structure of the Medical Examiner's Office from HCA Healthcare Agency to the CAO. With this change, the MEO will be a standalone department under the CEO with fiscal oversight and support to remain with HCA during a short transition period. This change will allow greater independence and continued focus on some of the MEO's challenges. Law enforcement, the healthcare agency, and the CEO's office are all supportive of this change. Dr. Christopher Young, the county's chief medical examiner, has a short presentation for you today. Thank you.
Good morning, Dr. Young.
Good morning, Chair Bennett, board members. I've been allotted 20 minutes to describe a proposed change in the reporting structure for the medical examiner's office. As the chief medical examiner, I recognize that these are 20 minutes of your lives you can never get back, so I'll try to use the time wisely. What we're actually proposing is moving, as was stated, moving the medical examiner's office out of the healthcare agency and putting it under the administrative oversight of the CEO. This would accomplish a few different things. First, it would create a more streamlined reporting structure, which is currently shared between the healthcare agency and the CEO. This would move closer to federal recommendations of making the medical examiner's office a independent agency within the county, and would move closer to an ideal medical examiner system in our county. Before going further, though, I would like to thank the healthcare agency for their years of guidance and support that they've shown our office. We also appreciate the support of the CEO and the board. So I'd like to put this request in context, and that is that Ventura has a unique medical examiner system. It's unique in the United States, and it's unique within the state of California. This is a photograph of our beautiful facility, which is on the VCME campus. Recently, John Oliver on Last Week Tonight, it's a show that he hosts, and he described the difference in the types of medical examiner systems in the United States. So depending on where you live in the United States, medical legal death investigation is performed by one of two different types of systems. The first system is a medical examiner's office. So for about a third of the country, death investigation is overseen by a physician. This is usually an appointed position by the county or state governing body with specialized training in forensic pathology. And so in Ventura County, that's exactly what we have. Medical legal death investigation is overseen by myself and Dr. Mena. We're both went to medical school. We're board certified in forensic pathology. And we decide when autopsies should be performed, when toxicology should be performed, and ultimately what should go on a death certificate. The second system, about 2/3 of the country has a coroner system. This is a more antiquated system that came over with the settlers. This is an elected person, and they don't have any particular qualifications in many jurisdictions. So the qualification in California is that the person be registered to vote. So essentially, you have to be 18 years or older, a citizen of the United States, and you have to be not currently incarcerated or on parole for committing a felony. And in California, we have a unique system that the majority of the state is under a sheriff-coroner system, so the duties of the coroner and the sheriff are shared. So California has been somewhat slow to warm up to the idea of a medical examiner system. Out of the 58 counties in California, only 5 are medical examiner systems, Ventura being one of those. Somewhere between 41 and 48 counties are sheriff-coroner systems, and the remainder are elected coroners. The change in Ventura actually was not a recent one. It occurred 45 years ago in 1974 when the Board of Supervisors abolished the Office of the Coroner and established the medical examiner office that we have today. And our current building was built in 1996. It's this modern system that attracted myself and Dr. Mena to come to Ventura and practice forensic pathology. For decades, there have been national recommendations to switch over from a coroner system to a medical examiner system, and this dates back to the late 1800s. The most recent recommendation came in the 2009 publication entitled Strengthening Forensic Science in the U.S. This came out of the National Research Council and the DOJ. And in their writing, they recommended that Congress should allocate funds to states to establish a medical examiner system with the goal of replacing and eventually eliminating existing coroner systems. And so I'm very proud that Ventura has already made this big step forward. They also recommended regarding administrative oversight that a medical examiner system should be an independent agency to avoid any conflicts of interest. And that's exactly what we're proposing today. The MEO and the CEO recognize this as an opportunity to move the needle further in the right direction. In 1986, the Ventura County Historical Society put out a quarterly. It's probably not very much viewed anymore these days. It's somewhat dated, being 33 years old. But it was very interesting. It went through the history, the rich history of the coroners and medical examiners up until 1986. And at that time, Dr. Lovell, Warren Lovell, was the second chief medical examiner in Ventura. And he served from 81 to 93. And in the very end of this quarterly, there's an epilogue written by Dr. Lovell, and he explained that Ventura County is of the counties that have a medical examiner system, it's the only one that falls under the healthcare agency. He went on to say, it's foreseeable that Ventura County's medical examiner office of the future will, and when I read those words, I think for most citizens of the county of Ventura, probably glaze over and get a little bit bored, but for me, in the back of my mind, I hear, I have a dream. And so in his I Have a Dream epilogue, Dr. Lovell described, in the foreseeable future, the MEO will be housed in a new modern building in Mid-County, and that took place 10 years later in 1996. So we have that one checked off. And the second part of his I Have a Dream epilogue was, in the foreseeable future, medical examiner's office will be an independent agency within the county. And that's something that he proposed 33 years ago, and I think it's still a good idea. And that's exactly what we're proposing today. So in summary, this change would be a cost-neutral change. It moves us closer to national recommendations. It puts us more in line with the other counties in California that have a medical examiner system. It streamlines our reporting structure. And most importantly, this is something that's supported. It's supported by the CEO. It's supported by the medical examiner's office. And it's supported by the healthcare agency. At the risk of sounding too clinical, I think it's a no-brainer.
Thank you very much for that presentation. It's good for us to get a little opportunity to interact with you. We don't get to have that opportunity very often. Certainly does seem like it's a common sense change to make, and it does give us that independence for the medical examiner that is the gold standard out there. So I appreciate that. Do board members have any questions, comments? Supervisor Long?
Actually, Dr. Young, I want to just say thank you for your wisdom and also your humor. We at the board today did not get to enjoy the video I got showed last week when I toured the facility, and it was really hilarious. I mean, he has a serious job, and yet the fun in doing what you do and making sure that it is improved, and the difference between a coroner and a medical examiner, the comedy gentleman, it was really funny. But I just really appreciate the vision. And we talked about medical examiners and how few there are. And so I want to thank you for picking Ventura County because I know that the system that we've done is exceptional. And I would definitely support this. And thank you for, if anyone has seen it, you should go to our facility. And I also want to extend a thank you for all that you did with borderline shooting and all the other horrible things that have happened in this county. You guys really just want to say thank you.
Supervisor Parks.
Okay, no comment other than.
All right.
Supervisor Huber.
Yes, I want to commend the coroner's office here in Ventura County. It's always been a well-run office. I had the occasion to actually interface with them for the better part of 40 years. I was a person who was in the, and I'm still a licensed embalmer, a piece of trivia there, but I was in the mortuary business for many, many years, and our coroner's office has always been well-run. And so I commend your office for the stewardship they've had over the years in this county, having been very closely connected to them for decades.
Thank you, Dr. Young. I toured your office before you were there, but it was run well then. I'm sure it's run even better now. Thank you. But you had one in your presentation, a conflict, to reduce conflict. Who would that be with if the?
Well, it really, there's less conflict of interest, obviously being under a healthcare agency than being under law enforcement.
Okay.
Obviously, with the same person filling out a death certificate as the person who might be incarcerating someone, you could have a severe conflict of interest.
Mm-hmm.
In the case of moving this office to more of an independent agency, it's really just making it more independent and able to run more efficiently.
More efficiently.
It's very easy to be considered a health agency or a health department by a healthcare agency, and really we're a medical legal. We provide medical legal service, so it's a very unique type of work that we do, and it seems to work better as an independent agency.
Well, thank you. I think you're providing a good service for the community. Thank you so much.
We have a motion and a second. I think we're ready to vote.
Thank you.
Dream has come true. All righty. We have, let's do our consent calendar very quickly. Motion to approve item 60, and then we'll go to our 10 o'clock time certains. 61, thank you. We have a motion and a second. We're ready to vote. All right, we'll go back to item 50, our 10 o'clock time certain. There we go.
hit it, but it didn't come up.
Supervisor Long.
Thank you very much. Today is an exciting day for the Stern family, even though I've tried to postpone it as long as possible. Today we're celebrating Bart Stearns, who for 17 years has served our public as the Assistant Appeals Board. So Bart, you're here today. If you can come up to the podium so that we can rave about all the good things that you've done. So if you don't know Bart, he was first appointed at the Assessment Appeals Board as an alternate in July 2002 and hit his regular position in 2014. Bart was perfect for the job because his extensive experience as a real estate broker, licensed general contractor, and owner-manager of many commercial properties. Bart has served as chair of the Assessments Appeal Board #1 for 9 years since beginning nominations by his fellow board members in July 2010. Bart served on the board during the Great Recession of December 2007 through June 2009, when the board was receiving an average of 5,000 applications per year to review, and the board held meetings almost weekly. How do you get your own job done when you're doing this? And over the years, Bart has attended over 200 meetings. 100 of those meetings were as chair. Bart is well known to ensure all parties had an equal and fair opportunity when presenting their property appeals case to the board, and always greeted and began every meeting with a benevolent smile while maintaining a professional demeanor. And for those who don't know Bart, he is the president of Ventura Investment Corporation, which has been ranked by the Pacific Coast Business Times as the second largest operator of residential properties in the Central Coast. Bart lives in Camarillo with his wife of 25 years, Heidi, and their 4 children. Bart, the Board of Supervisors would like to honor you for your 17 years of service to the community and extend our sincere appreciation for your dedication to the residents of Ventura County by presenting you with this proclamation. Now, I know you don't like all the drama looking at you. However, we have some people that would like to make some comments in regards to you. So first, I'd like to give you an opportunity to speak, and then I'd like to invite several others later on.
Well, thank you. That's very nice. Good morning, Chairman Bennett and supervisors. It's been such a great honor for so many years, I guess now, to serve the county and hopefully to share my experience in a way that's helpful to the process. And what I've really appreciated most over the almost 20 years is the relationships and the people, and really understanding the great and appreciating the great people who are either elected or are employees of the county. And so just off the top of my head, first, the people who I've served on the board with, other private citizens who have volunteered, including for over 10 years, Vice Chair Vince Curtis, Jim Crow, and Pat Little, 2 of whom predate my service on the board. And also, I've come to appreciate the great work and the immense amount of information that has to be processed every year by Assessor Goodwin and his chief deputies and his staff. They do a great job, and I really congratulate and appreciate them. Also, the County Counsel's Office. We've had great counsel for so many years, currently from Emily Gardner and also Marina Porsche, Joe Randazzo, Mr. Smith for a brief period of time over the number of years, and originally Mr., well, I'm drawing a blank on that, Greenberg, Don Greenberg, for the first several years.
He started right out of high school. We recruited him and everything.
But the greatest appreciation, especially in recent years, has been the work from the clerk of the board's office that has served to streamline the process, make it better for the assessor's office, for the taxpayers, county council, for our board, led recently by Chief Deputy Clerk Rosa Gonzalez and Brendan Vlahakis, who clerks our meetings. They make it easy for us. So thank you again. I share any recognition with all the people who have been part of the process and make it a great experience. And so thank you. I look forward to serving the county in other ways in the future. Thank you.
Thank you
for your service.
So now I have Dan Goodwin, our county assessor. Don't go too far, Bert. It's almost like a roast.
Good morning, board members. It's really a great thing that you're taking some time to honor Mr. Stearns. It's he's not a standard employee, kind of the regular traditional thing, but it's his role has been very important to good government of Ventura County. So the assessor is certainly commends your board for the decision you made to recognize him and his dedication throughout his 17 years on the Assessment Appeals Board. As your appointed representative, he really sits in your chair. In small counties, the Board of Supervisors often serves as the Assessment Appeals Board. So this, more than most appointments that you have, is one that could often be filled by you yourselves. And so the issue of how the public is treated, the public's respect for the process and those that are involved are very important, which really brings me to the things I think are key about Mr. Stearns. It's certainly a cornerstone of the assessor has been administrative integrity that I know is important to you too. And that's something Mr. Stearns brought. His approach to each hearing is without a preconceived conclusion, without an agenda. He looked at the evidence, let the evidence lead him to a conclusion. And that's what you want in all your board members, somebody who can discern between the wind and the emotional issues and some of the noises and bring it down to what are the facts that are about the issue that's in front of them. His leadership as chairman for the 17 years, most of those years, has helped all the Assessment Appeals Board members be more efficient, more productive, and really more correct in their decisions. And oftentimes it's not easy. Sometimes there's situations that the emotions would want you to offer somebody some kind of consideration, right? But the facts may not point that way. And so it's a judgment that oftentimes the character of the individuals you select on the board, like Mr. Stearns, really show through. Just a couple more things I'd like to mention about him. He's always professional and courteous. And that too is tested at times. Believe it or not, there have been some professional representatives that would sit in this chair and represent their clients and do it in such a way to try to sway the board members and sometimes express their frustration at not getting their way. So the stability of Mr. Stearns to handle those kinds of things and to continue to be courteous and professional is just an outstanding characteristic. So thank you, Mr. Stearns, for all you've done for good government in Ventura County. I appreciate it. The taxpayers certainly appreciate it. And I know this board appreciates your work too. Thank you.
Thank you. Next up is Rosa Gonzalez, our Chief Deputy Clerk of the Board.
Good morning, board members, CEO Powers. On behalf of the County Executive Office and the Clerk of the Board, and I would also include the County Counsel's Office, Joe Randazzo and Marina Porsche, who also assisted as County Counsel to the Assessment Appeal Board. We really do thank Mr. Stern for all his service and all the years through the numerous appeals that he's sat through and made some difficult decisions. And also it's a very intimidating process at times for the average homeowner that follows through the process to appeal their property values. And Mr. Stern, along with the other board members, are always very welcoming and clear in the instruction, direction, and also their decision and the process to help those taxpayers understand exactly what is why the decision has been made on their values. And that's actually a really hard decision to let someone know and make them feel good, actually, that they've actually had a fair hearing. And Mr. Stern, along with the board members, have done such a wonderful service to the taxpayers of the County of Ventura. And we just would like to thank you for your patience and your professionalism. And it was an honor working with you through all these years.
Thank you. Joe and Marina, do you want to say any words? I'm giving you the opportunity. I appreciate you all being here.
I wish that the members of the public knew how conscientious and careful and meticulous and thoughtful Chairman Stern and the other AAB members are when they're in closed session reviewing all the evidence and the facts of the cases. He has utmost integrity and professionalism, and I thank you very much for your service.
Wow. Thank you. Board members, CEO, anyone?
I do want to say thank you. We have volunteers that give so much of their time, and it really helps the entire county. So thank you for volunteering your time for this. I know it's a kind of a technical thing, and your expertise really came in handy. So thanks for the many years and the professionalism.
County falls apart if people don't do the behind-the-scenes things like this. So thank you very much for being one of those people willing to step up.
Thank you, Mr. Stern.
I would just add that I wasn't going to say anything until Supervisor Long said it was a roast. So, a few things to say. No. Really, I want to speak to the fact that Mr. Stern's reputation also in the real estate community is extraordinary. It's impeccable. So to have him sitting on this commission also brings great credibility to the entire commission. And as was already said before, the way he treats the public and our staff is wonderful and thoughtful. So just thank you for the wonderful service, Bart.
And also, I wanted to thank the family. He could be spending many different ways with his time, and yet he chose to serve for our public. And I know that it takes away from the family sometimes, and I want to say thank you for supporting your father and your husband. It's really been a great benefit for our county, so I want to say thank you. And with that, I have a resolution to bring down to you, and I would like to ask all the board members and our CEO to come down, and then also to take a picture, and then also with the family. So thank you. Congratulations.
Thank you very much.
Okay, so we're going to put you in the middle. Come on over. All right. We'll get one picture, and then I'd like everyone else to come in.
Moving around in the background. It's Rosa.
All right. And then
You're supposed to.
If you can come down also.
With the family.
With the family?
With the family, yes. You stay right there.
Okay.
Come on in.
School's out. I got to take advantage of it.
One big thing. There we go. You can see instruction. 1, 2.
Thank you.
Thank you. Thank you very much. Thank you. Thank you.
Congratulations. I didn't know you were retiring, but you deserve it. Thank you.
Back on for another one.
Thanks, Mark. Good to see you. Thanks for your time.
I'm sorry, say it again. We'll get to that as soon as we finish these items here, all right? We have, we're now ready for item 51, and that's a transit service. Public Works Agency. Morning, Mr. Fleisch.
Good morning, Chair Bennett, Supervisors, Mr. Powers. For the record, I'm Dave Fleisch with the Public Works Agency. As those of you who've been on the board for a while know, every year I come and talk to you a little bit about transit service in the county, primarily to cover those services that the county sponsors or funds. For this year's presentation, I'm going to do that, but I'm going to take a little bit different tack also and talk a little bit about service overall in the county and some things that your board might want to consider a little more detailed presentation on. These are the transit services that the county sponsors or participates in. As you're aware, in 2014, at the formation of the Gold Coast Transit District, all of our Transit Development Act funds go through the Transit District, and then we're authorized as an operator to request funding from Gold Coast. And we have done that annually. Our claim for this year, which is attached to the board letter, is about $1.8 million, which is up from the 1.3 previously, and that's, I will talk about that later, but it's primarily due to some increases in our contracts. Also, we do claim funding for capital funds, and we have several projects underway right now, so we're not asking for capital this year, but we expect that we will in the following years. The Transportation Development Act, which was passed in the 70s, is essentially the Bible that we follow for the funding for the services, and it requires a ratio of passenger fares, or the fare box ratio, compared to the overall operating cost. And based on the census in the state, it defines what's urban and rural, and the urban areas require a 20% fare box, and the rural areas require 10. That may seem sort of odd, but Ojai is in the Ventura urban area, so it's required to have a 20% fare box. It's not something we really have any choice in. It's the way the law has been set up. Our operators throughout the county, as well as many others throughout the state, are finding some challenges in operations. We're seeing on the fixed route services decreased ridership. We're seeing increased costs for operations, primarily due to salaries and some other sorts of things. And then in the state, or in the state outside of the county, there's many of the counties have a self-help tax, a tax that they provide through sales that helps them provide an alternative source for revenue for transit. As your board is aware, 3 times that's been tried here in Ventura County. It has not passed. So the fare box ratio or fare box amount can be provided with other funds, and that's typically handled with those funds in a lot of other states. What's interesting to note is the legislature has asked the California Transportation Agency to develop a working group to actually look at that whole process. We've been providing input through the commission and also through CSAC on what that is. And one of the things they're actually looking at is, believe it or not, the fare box recovery ratio is in the law as a performance measure, and it's sort of kind of counterintuitive if you look at it, in that if you don't collect enough fares, they take money away from you for service, so you provide less service, so you can't collect fares, which just doesn't seem to make sense. So one of the things they're asking is to look at the performance measure. Is that in fact an appropriate measure? Until the law changes, however, that's the measure that we have. This just gives you a picture of the ridership across the different services within the county. You will note that the Ojai trolley is not shown on here. It's a very small bar. It would be on there about on the same order as the Canaan Shuttle, which is the top bar that you see up there. You'll note that Gold Coast is the largest by far, followed by the Ventura County Transportation Commission intercity service, and then they get significantly smaller from there. I'm going to walk through each one of them fairly quickly. Gold Coast, as I just mentioned, is the largest operator in Ventura County, and it comprises the areas of Oxnard, Ventura, Port Hueneme, Ojai, and the unincorporated county around those areas. About 4 million trips annually, and that's about 70% of the ridership in the county. As you can see, their fixed route ridership here. The green bar, I think that's green, kind of a green gold color there, is the 18-19, and you can see that they're running below where they were. One of the challenges when you look at the 17-18 number is that the second quarter ridership in that year was pretty deeply affected by the Thomas Fire, and so the recovery this year, you could see quite a bit more for that reason. And this year, the third quarter ridership, because of the heavy rains that we had an effect. And amazingly enough, bad weather has a pretty substantial effect on transit ridership.
Do you know why it took a bump up in 2016-17?
I'm not specifically aware of that. I can get that information for you.
It is about 100,000 more between February and March. I was just wondering what might have.
I do know that they added some service during that year, but I don't know if that's the reason.
Gave the free rides to the university?
That's only been in the last year, so that I don't think would have been then, but I can check and find out for sure. What is interesting to note is the paratransit service, the Gold Coast Access, has seen a pretty significant increase in ridership year over year and quarter over quarter. And that is true for all of the dial-a-ride or paratransit services in the county. Our service in the East County has seen a 35% increase since it started in 2015. Our portion of the dial-a-ride service in the Thousand Oaks area has had multiple years of increases, and this seems to have stabled out this year. And we've seen an almost 10% increase in the dial-a-ride service in the Heritage Valley. Some of the reasons we think for that, based on the studies that the different operators have done, are an increase in the senior population, because the baby boomers are aging. There's also an increase in dialysis and recurring medical appointments, and there's been more folks attending the senior nutrition programs, and so those are where we typically see those increases in ridership for the paratransit. We expect those to continue for a while. One of the challenges we have with the paratransit service with the multiple operators throughout the county is having to make a transfer from one service to another for someone who's already having difficulty with their mobility. We want to try to minimize that as much as we can. In the Ojai area, there's the Ojai trolley. It's a good picture of the service. It serves those areas that you see stated up there. About 50% of the services in the unincorporated area in and around Ojai. It is in the Gold Coast service area, but was not included in the Gold Coast service when the district was formed, because it's a local trolley service, and it was chosen to continue to be maintained and operated by the city of Ojai. We have some challenges with that service in meeting the fare box recovery. As I mentioned, they're 20% because they're rural. Although they're rural, they're considered urban from the census perspective, and so they have to meet the 20%. We've been working with them over the last year and a half. They've increased their fares, reduced some service, added advertising to get some additional revenue. But this year, we see a shortfall of about $50,000 in meeting that fare box ratio. There's a pretty good discussion in the board letter, and I'm not going to try to explain to you how the penalty phases work, but essentially the noncompliance year was last year, the review year is this year, and the penalty year is the 2020. I'm sorry, the review year is the year coming up, and the penalty year is the 2021 year. So there will be money required in the 2021 year, which likely we will be asked to pay half of, which will be somewhere in that.
Dave, Ojai is considered urban because they're under Gold Coast Transit or under the city of
No, sir, they're under the Ventura urbanized area based on the census. Okay. So again, it's sort of an artifact of the way that's set up.
Because if they were rural, then it would be the 10% would take effect.
If they were
treated like the Santa Clara Valley service,
they would meet fare box recovery, yes.
Yeah.
They would be meeting their fare box recovery. Right?
Yes, sir.
But because of the Ventura influence, I think.
It is also interesting to note that Stanislaus County last year went with legislation SB 903 to ask to be allowed a pilot program for a blended fare box. So they have some 20, some 10. They asked for a blended of about a 15% in some areas. Might be something not only for this, but some others that we might want to consider for Ventura County. That would be something certainly through the commission would probably be the most appropriate way to do that. The Valley Express, as we just talked about, Santa Clara Valley service began in 2015. We serve both a fixed route and a dial-a-ride service out there. We do have in that area also a problem with the fare box recovery. We're running at about 6 or 7%. Fortunately, the city of Santa Paula has measure money from a general sales tax for the state or for the city, and they are using that in lieu of Transportation Development Act funds for some of their funding of this, and that allows us to have meet the fare box recovery ratio of 10%. because they are a city under 100,000 and not in the Gold Coast district, they're allowed to spend their TDA funds on streets and roads. So they're literally just making a swap of funding, which allows us to meet that. That amount this year was about $100,000, if I remember correctly. Another thing with the Valley Express, this is the first first time we've run this service under contract. It's run through the Transportation Commission. We just, the Heritage Valley Policy Committee and the Commission approved a 3-year extension to that contract, which expires in 2023. The memorandum of agreement between the city, 2 cities in the county and VCTC also expires then. And there will be an opportunity in the next couple of years to take a look at whether or not we want to continue that operation as it is.
Right, and just to note, we do a lot of marketing now, which wasn't happening. And so we're trying to make sure that the students and the community members know where the routes are and how they can access a dial ride. So we think that that'll help with the fare box recovery also.
Dave, has Valley Express thought about maybe joining Gold Coast, or to kind of, I know that.
That hasn't been a discussion to date because we have an existing service, but as we move forward to 2023, that certainly would be something.
That might help them with the recovery ratio too.
And then the final portion of the service that we have is in the East County. As a result of the studies that were done at the same time that Gold Coast was formed, we established the East County Transit Alliance, which are in the cities of Moore Park, Thousand Oaks, Simi Valley, Camarillo, and the unincorporated county. The city is the operator for the county themselves and Moore Park, and also for Westlake and Agora Hills. We have a new contract that will be starting 1 July of this year. It's with the same operator, MV. There's a significant increase in the costs, and what it really is doing is bringing them in line. If you look at what we were getting in the previous contract, was it significantly below what the standards in the area were. So this is really bringing that up. The specific services they provide that we have separate agreements on are for the Canaan Shuttle, our portion of the Dial-A-Ride, and also the Dial-A-Ride service within the East County group. I'll be bringing those to your board. We're in the process of updating those agreements now. They weren't prepared for this, so they'll be coming as a later item for your approval. As part of the East County Transit Alliance, we're trying to look at what our future is. Where do we want to go to try to be more regional as a group? We have some challenges. One of those is Camarillo runs their own service via a contract. They currently don't participate in any of these services, including the intercity Dial-A-Ride. Simi Valley runs its own buses and owns its own buses and runs those with their own staff. And so both of those have some specific uniqueness to making any decisions and moving to a different opportunity of doing things. We do have the intercity Dial-A-Ride, and again, that's 4 of 5 of the operators, or 4 of the 5 of the agencies, and you see the map up there. So someone who's a senior or disabled can take one service and get anywhere within that area. They are allowed to be taken to Camarillo, but then they need to be transferred to Camarillo's service to go wherever they need to go within the city of Camarillo. As I mentioned, the challenges to full partnership for Camarillo and Simi Valley are things that we need to look at. We are considering, as part of our implementation plan, which is also attached to the letter, some sort of a master plan or a consolidation study to look at more formalizing exactly that connection between the different agencies that are there. As I mentioned, the Canaan Shuttle, approximately 80,000 trips a year. It is part of that new operations contract, and we are seeing a significant increase in the cost. That currently is fare-free. It's not a free service in that it costs us to run it, but it is fare-free. That is free to the people who use the service. That's currently being made up, that 20% of the operating costs, through contributions by CSA4, the Oak Park Unified School District, and the city of Agora.
You know, I just comment that I was trying to see if we can get another section of this, but it wasn't in Ventura County. It's part of LA County, Westlake, Agoura Hills, and just realizing they don't have this incredible benefit of, 80% of it being paid for by the state and only having to come up with 20% match instead of doing the fare box. So it is a pretty unique thing that we can do here in Ventura County and encourage it. Getting partners out there to fund the fairs.
And finally, a year and a half ago or so, LAFCO did their 5-year municipal service review, and they focused on transit as one of the primary issues. And I know they made a presentation to your board. This is really just a summary of their recommendations. As is not a surprise to most of you who've been involved in transit here for a while, it's a complicated system. It's a difficult thing for people to understand how to navigate, and recommendations moving forward from LAFCO were to try to perhaps consolidate more, regionalize more. So you could consider countywide transit as purely a VCTC responsibility. We have the unique, your board has the unique opportunity in that you're the only entity that really touches all of the services in the county. VCTC really does not. They don't have anything to do with the Ojai Trolley. They really don't have anything to do with the East County Transit Alliance. They really don't have an involvement with Gold Coast other than attending the meetings. And so your board represents all of that transit. So as we move forward, I bring to you 4 issues for consideration. If your board has any desire in us bringing those back in a more detailed manner to have any sort of discussion on any of those 4 items. With that, I conclude my presentation.
Supervisor Long.
Yes, you have the Heritage Valley organizational structure and contract. We can't address that till 2023, correct? Or 2020, like you RFP.
Right. Yes, ma'am. It'll be probably 18 months prior to the expiration of the other contract that we will need to start into whatever that process is. So an opportunity to begin the discussion now really is not all that too soon.
All right, fine. I know government is slow sometimes. Or the contract process, not the government. Excuse me, I misspoke. Yes, I would want to make sure that we're optimizing what we're doing in the Heritage Valley because we only have a certain amount of dollars.
And I know that LAFCO, would like to see one agency for the entire county. Regional, it was one of the MSR IDs that they were looking at, if that was ever to happen. So that's one idea. So
Maybe it's a position our Board of Supervisors can take to encourage.
have one agency, and I think it's
regionally.
important to have.
Yeah, you just think about the cost savings. Every single agency has their own administration. Right there, you'd save a lot of money. Plus, it'd be seamless for the patrons.
And Gold Coast, of course, the biggest and largest is, we're going to have a brand-new yard, facility that can really serve, the entire county for that matter. Okay. Anyway, ideas.
I would like to, at some point, agendize this for more in-depth discussion in terms of, for instance, we're from the East County, in terms of focusing on some issues that are, for all of us, that are important to our areas. It's going to take a little bit more discussion, would seem to me.
I think it would help Ojai, and it'll help Santa Paula and Piru and all those areas,
Yeah.
at least in West
Are
County.
you interested in trying to move to one agency? Is that one of the?
I don't know, I'm not there yet, but it just seems to me, those of us on the East End sometimes feel like, and I've lived there for a better part of a half a century, feel like a stepchild sometimes, and it's kind of always been that way, and it's gotten better over the years. Don't misunderstand what I'm saying, but I just want to get it on the agenda so we can talk about some of this and how we can support all the areas.
Mm-hmm.
We have one opportunity right now, and so if there's anything, but certainly good.
It's not really the agenda. It's if we did want to, for example, talk about, making one strong system instead of all these little systems.
That's right.
That, I don't know if that's really something we can.
Politically, I'm not sure if it'll work.
I think the board letter asks that you provide guidance, but under the understanding that they, staff would have to come back with details. But if you want to give them general direction of ideas that you would like them to look at and bring back, that's fair. But no, final decisions on anything.
Official position or anything like that.
Well, I'd like to bring it back at some point to discuss from our respective points of view, the different issues. That's all in depth, because this is sort of an overview.
Sure.
Again,
That's okay.
Mr. Chair, the last time we had this at LAFCO, we had all the agencies come up, East County, West County, and there was quite a bit of discussions. And if that was to happen, we'd have to invite everybody, I believe, but we've had that in LAFCO, and then East County wanted to do their own thing, and West County, and
LAFCO did, it was kind of a surprise to some, thought of transportation as a district.
That's right.
Did a very good analysis of how all the different transit systems work and the providers. And we had like the most positive input from city managers that we've ever had along the idea of let's all work together to get one unified system. I don't know if it went anywhere after that, but at least we got to that point, and our board as a regional body supporting that kind of recommendation that LAFCO had, I think is a positive step.
I think so too. I think that having one regional transit would really help us tremendously, lower the cost and the transferring. I know there was a lot of concern of people transferring from one city to the other, and that'll help tremendously, especially for people that work in different cities. So
perhaps we could,
maybe that might be an opportunity to discuss that.
and then also I think Kai Loma would probably be most willing to come and give his report, because just you and I are the only two
That's right.
who heard it. I think
So Kai has an excellent report on that too, Dave, that we can use. Yeah.
Maybe through the county office, we can bring a global group of people together just to brainstorm as the next step from all the different perspectives.
That's a good idea. Yeah.
Invite the cities as well.
Right.
That's right.
Everybody.
And Kai from LAFCO.
Yeah, just brainstorm it.
Because that was
See
part of
where everybody's coming from. Ultimately, as time goes on, we can unify this whole system.
And that was part of the MSRs, that we discussed in municipal service review that LAFCO does, to bring all the transits together, if we can. Good point.
My thought is, though, because we are a Ventura County organization, that we initiate something from our end, take a lead position.
when I looked at it closely, it just really came to evident to me that it's all based on the elected officials, because they run all the transit systems, and we all sit together, for example, on the Transportation Commission.
VCTC.
But if we all agree, then we could do it.
That's right. Good point.
Well, so I think the biggest direction you're getting is to agendize this back with the ability for us to have all the partners there and have that conversation. We did make one push. Many of us on this board really pushed to try to become one agency, and there was a fair amount of pushback from some of the cities at that point in time. But it is appropriate every few years to try it again and see if we're further along as we go forward and stuff. Right?
And we did have
to note that since the last discussions for regionalization, all of the city managers have changed, and 17 commission members have changed, and so some of that pushback, I think you got different folks in place now.
Sure.
And to that point, at our last city managers meeting, Mr. Kettle did raise this discussion, and I think it was very positively received. So we're continuing it.
And invite Kai to LAFCO.
So we have a motion and a second to receive and file and give the direction to staff to come back with sort of a all hands on deck transportation effort and stuff, right? Okay. All right, we're ready to vote on that. And while you're up here, Mr. Fleisch, I'm going to give you the opportunity to knock out the item 40, which we pulled to be heard as a regular agenda item.
Actually, I'll defer to Mr. Shepard.
There we go. All right.
It's his item, but it's
There we go.
that belongs to you.
Chair Bennett, members of the board, CEO Powers, good morning. Glenn Shepard, Watershed Protection within the Public Works Agency. Joined here with Mr. Dave Fleisch from Transportation, yes, because in the end, We're excited to bring a grant approval and authorization to accept a $13.4 million California Department of Fish and Wildlife grant to replace the Santa Ana Bridge located across the Ventura River in Oakview. Dave and I are up here to collaborate and bring forward to you at a future point the construction contracts that actually will use that grant. And the grant fully funds the replacement, both direct and indirect costs for that particular bridge. And that bridge will be in your county inventory once completed. And from the watershed protection standpoint, Chair Bennett, you brought up the aspect of the contribution of this project within kind of taking down the Matilla Dam in the future. This is one of 5 major infrastructure projects that's required to get us to that point, setting the conditions in order to remove the dam. And so this builds the momentum, as you indicated, to get us going along that line.
It's one of those things that removing the dam has its benefits, but there are also ancillary benefits that the county of Ventura. We end up with a new bridge, you know, and our bridge inventory improves that much by having that, and yet we're getting outside funding for that, which has been one of the arguments that we've made about the benefits of this project in terms of it's attracting state, federal, and private money to do some of the things that have lots of ancillary benefits for the residents of Ventura County. So I'll make the motion.
Could I ask if you could talk a little bit about the like environmental restoration that will come with it, and then if there is a community there of the notifications?
There'll be limited environmental restoration around the particular bridge site. I don't have the particular details going forward, but there's a broader aspect of Arundo-free removal within the Ventura River watershed that is also ongoing and complementary to this whole watershed response in eventually taking down and restoring habitat up through the Ventura River and Matilla Creek systems.
I know that you know, your agency is looked at as flood control, but it's watershed protection, and probably of any departments in the whole county, you're the ones that do the most restoration type of work. And maybe in the future sometime we could get some highlights on the environmental benefits that have come with the projects that you've done, because I don't think most of us know about it.
I'll certainly do that. Generally, our mitigation projects are a constellation of requirements that come, and we package those requirements together so we can do larger scale mitigations. Say we have, you know, hundreds of acres for various projects that we package and aggregate to maybe a 30-acre mitigation project in the future. I'd be happy to share some of those.
And you've also done some really nice pilot programs too, and trying to encourage growth of plants around that are effective for your so we can still have the structures but still have plants. So there's a lot of good information. I'd love that for you to come back. But also on that question, I don't know specifically this area, if there is an area of notification that you do when you do projects, when the community is impacted by noise or what, et cetera.
Yeah, Supervisor Parks, and through the process, our CEQA process, this project was approved, and we did a supplemental environmental impact report and environmental impact statement with this. Once we package together how we're going to execute the project and go forth, there'll be deliberate notifications, in particular around Oakview and the particular project site.
Okay, yeah, you know, where planning is required by law to send out notifications when there's a project to get input. I understand, you know, it's a project, it's an environmental document, people can have input, but when you're actually going to go out there and do the construction, it's always great to be able to give notification. And I know transportation's been really good at that too, when they're going to do something, so people aren't surprised when it happens. Thanks.
I'm sure that we'll put out plenty of notification ahead of time. The advantage on this project is we're building a new bridge north of the existing bridge, and so the impact on the public hopefully will be less, because we don't have to tear down the old one to put the new one in the same place. And so, but we'll work through and coordinate that.
Thank you very much. We have a motion and we have a second. We're ready to vote on this item. Congratulations. Keep doing good work.
Thank you.
All right.
Thank you.
We have item 52, our last 10 o'clock time certain item, and that's the Mercy House Living Centers and Development Emergency Shelters presentation. Good morning.
Good morning. Tara Caruth with the County Executive Office, and I'm really happy to introduce the Executive Director of Mercy House, which Larry Haynes, and they have been selected to be the operator of shelters in both emergency shelters in both Ventura and Oxnard. He's here to give you a little introduction to their organization and their best practices.
Welcome, and we hope maybe we'll contract with you to do the 8 other cities in Ventura County as soon as we can.
We're open for business. That works just fine.
Convince them to join in the effort, right?
Well, thank you all very much for having me this morning still. Sorry about that. I'm really very excited to join the service community of Ventura County. And just thrilled to be here and to engage in our good work in terms of not only developing shelter, but hopefully housing. I wanted to talk just a few minutes about who we are as an agency, what some of our best practices are. I will be brief. I know we're a little behind schedule here, so I'll go as quickly as I can. And I'm also happy to answer any questions anyone might have. Before I keep moving along here, please note that a lot of times when somebody does a PowerPoint presentation and they have photos, they're stock photos from somewhere, these are actually pictures of either our shelters or our permanent housing facilities. These, so it's not just something taken out of a magazine somewhere, for example. Mercy House exists. We are a homeless service organization. I am its original employee, so I have been at Mercy House just about 30 years, roughly. We started in Orange County, but we are also in San Bernardino and Riverside counties, as well as Maricopa out in Arizona as well. We've been at this a very long time. We have seen all of the evolutions of what's considered a best practice, from transitional shelter to housing first, which I'll talk about in a moment, and literally everything in between. Our whole emphasis is to try to end someone's homelessness, and we serve all populations that it's worth noting. Families, individuals, we've done AIDS housing, person with addictions, person with mental health disorders, as well as workforce type housing, and literally everything that you can imagine. Now, I am notorious for, when put on the spot, not being able to cite my company, my agency's mission statement, which I realize is failure 101 for any executive director. I do get that. And usually it's because I'm focusing on really what our end game is. And this is our mission statement. And by the way, the picture there is a permanent supportive housing project. That picture is in Santa Ana. We took a 77 unit motel and did a conversion on it. It has now been converted into 71 units of permanent supportive housing. Let me put that in some perspective. The folks who live there are the most vulnerable, the most hardest to serve, that were literally living on the streets and down in the Santa Ana Civic Center for the most part. Many of the folks who live there had been homeless for beyond 10 years or more. We've had one person who was homeless for 40 years. We've had multiple people that are homeless for 20 years. The people that are there are dually and triply diagnosed, multiple disabilities, active drug addictions, mental health disorders, folks who normally at once upon a time might have been institutionalized, folks that, historically speaking, when we see them in our parks, when we see them in our 7-Eleven shopping centers or whatever, we said, nothing can be done for them. Well, we measure ourselves, we're on a mid-year fiscal cycle, so July 1 to June 30th. Our retention rate, our occupancy rate was 94% last year. So what I do want to suggest as we talk about housing is that housing really does work. It's not just a pipe dream. I'm not saying it's always beautiful or easy, that it's not without its challenges, but it does in fact work, even for the hardest to serve populations. There are two things that I want to focus on in our mission statement. One, you read that we want to end homelessness. And please hear me when I say this. I am thrilled to be able to open up the emergency shelters in Ventura and in Oxnard, and Friday's a big day in Oxnard, right? Please understand, from my perspective, from our perspective, shelter is just the first step. That we will never, ever, ever end homelessness if we are not really focused on permanent housing. From a Mercy House perspective, all that we do is housing centric, right? We are not about measuring the number of people that stayed in a shelter, with all due respect to the number of people that we passed out hygiene bags to or meals served. We measure our success or failure by did we end someone's homelessness, which always has to do, did we place them in housing? And from a Mercy House perspective too, we believe that housing is something that you need to have to be a full human being. Let me repeat that. It is something that everyone needs to be a full human being. Therefore, we take a housing first approach, which suggests that what we want to do, and what all the studies indicate, is that what we want to do is get somebody placed in housing as quickly as we can, and then surround them with the supportive services they need, as opposed to staying for a prolonged time in a shelter somewhere and proving to us that you were deserving of housing. That was the approach in the 90s and has been really out of fashion in terms of best practice for almost 20 years now. And so we at Mercy House are housing centric and also housing first focused. The second word that strikes me is dignified. Human dignity is a big, big thing for us. If you will forgive some religious language here, I do understand separation of church and state. We were founded by a Roman Catholic priest who is still our chair. And the notion of human dignity, the notion of being created in the image of God, that you have rights and a sense of worth that is inherent to simply being alive, is a big deal for us. And the way that we feel that you express and demonstrate that you show and regard dignity for someone is really in three ways. First off, where are you staying? Is it clean? Is it orderly? Do you care about the environment? Do you care about the aesthetic? Listen, we make a decision about a person, about a place, about a business, about a restaurant, in about 8 seconds. About 8 seconds. And once that opinion is lodged, it is hard to replace it. So I could tell you, I think you're awesome, and I care about you. Let me shelter you or house you in a dump. You're never going to believe me because you've made your opinion. So therefore, when you hear us, when you see some of the pictures that we're about to go through, it's important. And so the notion of the quality of the environment is a big deal to us, not because we want to look pretty, but because it communicates a message to the people we're trying to serve that cannot be replaced, no matter how pretty our words are. The second issue regarding dignity is, how are we treating our people? How are we communicating? Are we being impatient? Are we being negative? Are we engaging in another round of blaming the victim? Right? How we engage the person is incredibly important. Now, that does not mean that anything goes, because we have to model behavior. We have to model the kind of decision-making that is going to get somebody up and out of their homelessness. And that's why the third component of dignity is this focus on housing. Because I may like you personally. I may have all the charism in the world. Bless you. I may have all the charism in the world. But if I'm not focused on what's best for you and solving your problems, not just feeling good, all my words mean nothing. And so that's why the notion of housing and dignity is so very important to Mercy House. On that note, here are two other facilities that we operate. The top one is the kitchen to our family shelter in the city of Orange. It's a gorgeous, it's one of the first, for those of you who are into state law, it's one of the first SB2 zone created shelters. It's actually in a converted warehouse, and it's really something to see if you ever want to come down. Some of you, I think, have. The one on the bottom, this is a point of pride. I live in Costa Mesa, so I'm just a couple miles away from this. This is literally in Newport Beach, and that is housing for homeless veterans. We actually have a Pacific Coast Highway address in a neighborhood that is filled with multi-million-dollar homes. And we have operated it now without complaint, without incident, without episode, without anybody's property values going down, without there being any sort of tragic circumstances that are so frequently referenced. It's actually working quite well. Well, we feel that we can bring to Ventura, and we are certainly not a lone voice. I know we're joining a chorus of other service providers and other people focused on this, but is this notion of housing, is this notion of let's stay focused on housing solutions. As I said, that's how we measure ourselves. This is actually a dated slide. Last year we were reporting 1,570 people were provided with housing solutions. It's actually a little above 1,700. That evolves because the end of our year is going to be June 30th. So watch this space. It'll actually grow as we talk. Funding. One of the things that I think that we can bring, not an empty promise because there are so many variables that are beyond our control, we can be a good partner in chasing down other dollars, whether they're federal dollars or state dollars. We work well with municipalities. We work well in putting together collaborative and joint grants. We've had a run of success, and again, you can't guarantee anything because there are variables beyond your control, but we have some bandwidth for that. There are a lot of public sources of funding out there that a lot of smaller nonprofits don't want because the administrative burden is substantial. And when nonprofits talk about that, they're right. But we have an ability to do that. We have that level of sophistication. So that isn't something that concerns us. Why do housing at all? What is important? Well, I will admit to you, as somebody who's been doing this for a while, I do have an altruistic motive. There's a humanitarian side to this. But I would contend that we can go beyond that there is a business reason why we want to do this. It is actually more expensive to do nothing for someone who's homeless than to immediately put them in housing for the rest of their life and just pay for it. We can have the argument whether philosophically it's deserved or earned, that's a separate conversation. But what is not a legitimate conversation is it more effective or cost effective? So I would contend from a business perspective, we want to do everything we can to get people off the streets, if not for common humanity, but for good business sense. There are a lot of frequently asked questions. I talked about housing first. Just briefly for those who maybe, you all I'm sure know what this means, but there may be some watching who don't. The difference between housing first and an older model really is in the name itself. Housing first is a philosophy, and it can manifest itself with a rapid rehousing program where you're getting somebody with a fair amount of capabilities and moving them into an apartment somewhere, sustaining them for a few months and walking away, or a permanent supportive housing model for somebody who is disabled and been on the streets for a long period of years. But the idea there is you don't fix somebody first and then bring them to housing, because really the magic is in the housing. Really where a lot of the healing happens is in the housing itself. Within the shelters that we'll be operating, specifically, you'll hear a lot about housing plans. Everybody who will be in either the Ventura or Oxnard facility, and any others we might want to open up on the east side as well, will have a housing plan. And that is to say, if you are a client there, you should not only have one, but multiple plans. How do you get out of here and into housing? What is the strategy? Let's be very, very clear, though. There's only a certain amount that a shelter can do. To a certain extent, it is going to depend on what our resolve is in creating the housing opportunities. The two go hand in hand. The shelter is the starting point. The shelter will get people placed. I understand that we already have, I think, over 25 people placed in housing since the Oxnard shelters opened up. It's already doing well. But for us to continue with that, there has to be a resolve to creating more housing. Drugs and alcohol, for those that are concerned, will not be allowed or used there. That is not to say that folks won't be under the influence when they stay with us. That is part of a broken person's life, and that is something that but it is not something that is allowed on site. The city of Ventura, to give them a plug, came down and visited a number of our sites. They visited both one of our large-scale year-round emergency shelters, something that we are also talking about doing in the county here, as well as the permanent supportive housing. And these were just some of their comments. I should also say, as part of the contingency that came down was law enforcement. And much to my dismay a little bit, they got there early and sort of scoped us out, which I thought was a little uncool, but I get it. And privately spoke with local police forces as well, for example, in the city of Anaheim and the cities of Santa Ana. So they could speak law to law, right? Get this guy who talks a lot out of the equation, tell me what's really happening. And probably our biggest supporters, our biggest advocates were, in fact, law enforcement because of the difference that it's made and because of the cooperative attitude that we bring. Just a final comment, and I will wrap up and answer any questions that anyone might have. If you'll forgive a political editorial here, and I want to suggest that this is, I am only speaking for my agency. I am not speaking for any other city or any other colleague. But we're not going to get very far in ending homelessness if in our communities we do nothing but snipe at each other. We're not going to get very far if we continue to frame the conversation as good versus evil. I think that's mistaken. I think what we have here, even when we try to place a shelter or place housing and the so-called NIMBY syndrome comes out, we have to understand that what we're wrestling with here are competing virtues. It's not good versus evil. These are competing virtues. And both sides are saying something virtuous. It is a good and reasonable thing for a business owner to want to turn a profit. I would suggest that in our cities here, we need more of that. We need more capital investment. We need to generate wealth in our communities, not only for those that are earning the money themselves, because in a true good system like that, you're creating a more livable community. You're creating job opportunities for people who want to work and want to move up. And you're creating just a healthier environment overall. And you're creating more resources for those that have fallen through the cracks. So we can't demonize people that want to do that. Likewise, and I'm speaking as a homeowner, when you buy a home, it is reasonable to want to see your property values increase. My daughter is a student up at Poly, right? It's about halfway through, maybe a little bit further. And the equity in our home wasn't to be a land speculator, but was so we could use that to help fund her college education, to give her another opportunity. That's not demonic. So that's what people do. That's reasonable. And we have to stop bashing people who care about those things. Likewise, and I say this as an unabashed advocate for the poor of 32 years professionally, it is also a virtuous thing to want to create housing opportunities and a more healthy and a more decent standard of living for our most vulnerable people that are living out in the streets. Those are virtuous as well. And if we're going to really solve this thing, and I think that we can, there has to be some give on both sides. I'm happy to get specific on what that would look like, but I think I've gone well over my time. I'm happy to answer any questions that you all might have.
Thank you very much for taking your time to come. We are embarking on the mission of trying to partner with our cities, providing, as you know, half of the funding for the development and the operating cost. And yet we're having the cities take the lead since it's in their particular city and so we've been a little bit more removed from the specifics. And so you coming today has really been helpful, and I appreciate it. More importantly, I just appreciate the wisdom of the things that you said, particularly your final comments about how we have to view this as competing virtuous interests that are out there at this point in time, because that is essential for us, because we have some real conflicts out there that we have to resolve, and I'm sure you've seen that. I do have one specific. I was at the Ventura presentation, and I've had this on my mind, and so since you're here, the whole issue of pets has been a real challenge for us with homeless. How do you manage these pets? What is the area like? Are the pets all together? Or how do you handle the noise, the barking? Do you not have them see each other? What have you learned about pet management that would be helpful for us, because we also have a great animal shelter system here and stuff too?
Sure. Very quickly. First off, my colleagues may not want to hear this, but law is such that whether you're running a shelter or housing of any sort, emotional support animals, et cetera, are by law supposed to allow access. You really can't discriminate based on that. So as a warning to some of us who have tried to prevent people coming into their programs because of such things, we need to be careful, because we're opening ourselves up to a lawsuit that we're going to lose, number one. So some of it is forced. The other reason you want to do this, and I will get to your answer to your question in a bit, but the reason why you want to do it, provide an opportunity for pets to stay is, especially for a person who's been on the street for so long, it may be the most important relationship they have in their lives. Right?
They feed their pets before they feed themselves.
Absolutely. So, again, it gets back to that dignity thing. If we're going to really take seriously how we treat the folks who are in our programs, well, we have to at least try to address the things that they care most about, number one. You know what? We have a whole protocol that talks about ratios and the numbers that are there and the space and how that's all. I won't go into that detail now. I can easily provide it for you. But let me give the highlights, which is it works. The truth of the matter is that it has not been disruptive. For example, once upon a time in one of our facilities, we thought that we would have people's pets sleep in a kennel outside of the shelter. We have since changed that to allow them to, we took a chance, did a pilot program to allow them to sleep with them in the sleeping area without incident. There are issues such as, maintaining your pet and leashes and being in, being in containers while people sleep and so forth. There's some common sense thing that needs doing. It's important to us that we engage the help of, of those who are more expert in this. I will say one thing from an agency perspective, and let me just put on my businessman's hat for a second. We contract that out usually with another with a vendor who will help provide some of those specialized services. That's what we do. And the biggest reason that we do that, one of the reasons we do that, one is a level of expertise, but two, I have to be able to insure stuff. I have to manage my risk. I have to manage my liability. And so the reason we go to a third-party source for that, and I know we are in conversations with some real experts here up in Ventura County to assist us with just that very thing.
So most of the time, are the pets in the sleeping area, or most of the time the pets in some kind of kennel?
It depends on what the facilities will allow, but what we find is that most people want to be with their pet as frequently as possible. Now, you create things like dog runs and everything, and things such as that outside, but really you have to have an emphasis of that the person and pet are together as much as possible, as opposed to separate.
And my other question is, how are you handling the whole issue of separation of males and females, and the issue of children? And do you have many shelters with children? And how much are you specializing? I mean, you talked about the veterans situation that you had there. We found much more acceptance for veteran shelters than any of the other shelters. What is the mix that you have, and what is the mix that you would anticipate for Ventura and Oxnard, for example, just so that we'd have in terms of how you're handling those issues?
So some of the creation of the beds, we've sort of taken the lead from city staff because they have the most local knowledge. So, for example, in Oxnard, for example, which is, I believe, I'm going to get it right, 110 bed facility, if I'm not mistaken.
At the Armory.
At the Armory, correct. It is both obviously single male and female, but also we have a small room set aside for families as well. When it comes to this, it really depends on the shelter, and honestly, it depends on the construction. Because you do want some separation, when it comes to families. I think we have to be mindful about that. And we run both. We run emergency shelters, for example, that have both families and individuals. If the physical design allows for safety and allows for some separation, we also do other shelters that are just single adults and also some that are just families. And in our housing stock, I have to look at our data, but it's a fairly it's a pretty healthy mix. When you house about 1,700 people, you're doing a fair amount of both. It's both families and individuals. And in housing, bear in mind, you're in your own place, so it's an entirely different thing.
Mr. Chair, I know that Linda wants to talk, but we have a Oxnard housing representative that might help us out with what they're doing at the Armory. I know he can also talk about animals, because I know I've been there.
And I have one more question for you.
Not going anywhere.
Before we go on.
As he comes to
that.
And how they separate the women and also the animals too, because I've been there at the Armory, so you might want to help us out a little bit.
Good morning, Mark Alvarado, Oxnard Housing. I don't want to supersede Larry, he's the expert here, but I can tell you what we're doing specifically in Oxnard. So it is a low barrier shelter. Women and men, adults is the primary client base. But because we are the only emergency shelter in Ventura County, we encounter families frequently.
That's right.
And so we have to accept them because sometimes they come in the middle, like today. You got to excuse me, I've been at the shelter since 3 o'clock this morning, so I'm a little sleepy.
Well, thank you.
But we had a family come in at 2:30 this morning and with very young children. And, it's a situation where we have beds reserved and PD has to escort them in, and whatever the domestic violence, probably I think the situation was. So we accept children, but where the county comes in is we immediately contact Homeless Services with Marissa Mock's group, and they come in and they perform the triage, and we try to get these families out of the shelter as soon as possible and get them into the more appropriate setting because of the low barrier situation. As Larry described, there are folks that are diagnosed or working with different personal issues, and so we try to separate that as soon as possible. So we do have a separate room, and we do create space for the families. As far as the animals go, which is one thing that's near and dear to my heart, is our relationship with Buddy Nation. And they've come in to really provide us with the capacity to do the kenneling and food and working with the county animal services to ensure that the animals get their appropriate shots. And Buddy Nation usually covers that. And so we have cats and dogs of all shapes and sizes. And generally they do stay in the kennel, but the little ones get to sleep with their
right next to their.
Oh yeah,
I've seen them there.
and we have that, and so it's it's a labor of love, and as Larry described everything, it's they're coming in with the expertise to ensure that all of this runs in a very safe and healthy environment. So we're excited that they're on board. As a matter of fact, they're onboarding with us on Friday. And they'll be fully taking over, and I can tell you that they've hired about 80% of what the city had provided, and they're also bringing in some other new people. So it's an exciting adventure, and we're just looking forward to more services.
Thank you.
Thank you very much for coming down.
Chair, I believe you had another question for me?
Yeah, the other major issue is, getting the housing, every place is sort of challenged in terms of the amount of housing. How long are people staying in your shelters in general? How long does it take you to place? And where are these placements? What percentage of them are going back to relatives and that? And what percentage of them are going into actual, traditional housing?
Sure. So, in terms of the length of stay, I'm almost reluctant to give you the number, only because, I'll just take one of our programs, the one in Anaheim, Bridges. Your average length of stay in terms of somebody who's placed into housing is roughly 60 days or so, but that's incredibly misleading because one, are you measuring median? Are you measuring average? I mean, there's damn lies in statistics, so some of it really depends on how you're measuring it. We have outliers, people who have stayed with us several months at a time because of their vulnerability. It really all depends on, on the individual person. I would say the placement, though, to be fair, and it's not just us, it's any shelter, has less to do with the shelter itself and more to do with the surrounding structure around it. Do you have housing navigators, either by the operator of the shelter itself or external agencies that are working to get people in? So the way it breaks down, is there is no such thing as a one-size-fits-all, right? And so what you want to do is you want every engagement, every strategy that you employ based not on ideology, not on gut, not on any of that, but strictly on data. And so the way that we bring it, our best advice, our best counsel, whether it's accepted or not, is to adopt a flexible housing solutions plan that's based on data. And where do you get that data? You do interviews, you do assessments, and you understand that this group, what this person needs is more of a homeward bound or family reunification program. They want a train ticket or a bus ticket back to Cincinnati. They want to go back somewhere else. And that's a relatively inexpensive intervention, right? Another group, as you do the assessment, you understand that, they are here because of some sort of economic, unfortunate episode that happened. But this is somebody who can work, somebody who's willing to work. And so they are prime candidates for rapid rehousing. That is most families, by the way. Most families are going to fall in that rapid rehousing category. And that's true all across the country. And so with that, what you want to do, the strategy that you want to employ there is to get somebody placed in an apartment, and you provide, some level of both rental assistance as well as case management. Could be as short as 3 months, could be 6 months or beyond. It kind of depends on the design of the program and the vulnerability index. Then you've got a section of people that, let's just be honest, they're not going to work. The damage is too far. And the only real choice we have is to let them stay out on the street or to place them in what's called permanent supportive housing. And that is usually combined with housing vouchers that go along with that. And the way that you address that is a housing voucher system that's either going to be tenant-based, so you have a scattered site model where they make use of housing opportunities in pre-existing housing. Honestly, not my favorite. or secondarily, what you might call more centralized housing, such as a couple of projects that we showed you up here. And the reason for that is that you're going to have higher outcomes in those centralized versions. The reason you don't do that for everyone is because it's expensive. The rapid rehousing or the diversion are far cheaper. We live in a world of limited resources, right? If there were no limits to how much we could spend, we would just voucher everyone and be done with it. That's not a world that I know. And so what we need to do are make really prudent decisions on who we house and what. I would say over the last 2 years, roughly, at the Anaheim Bridges Shelter, we have housed, I think we've placed a little over 180 people directly into permanent housing, which is a pretty decent rate. We have a Santa Ana emergency shelter. All these are very similar to what the end game is in Ventura and in Oxnard. I think since Christmas, I think we've housed about 50 people. I mean, so it's at a fairly decent rate. But there are so many variables that play into that as to why that might be successful or not.
Thank you very much. Supervisor Parks?
And that answered one of my two questions, and that the answer is variable because it depends on the individuals. My question was specific to, you do work on those pathways out of the system, and I think that's important because we can get kind of comfortable in the situation that you have, and it's difficult to move forward and have that pathway. The question I have, do you have any facilities that are small, or you just deal with
Well, I guess it depends on your definition of small.
What's your smallest, I guess, is the question.
Let me think here for a quick second. Well, I mean, we've actually done permanent housing in single-family residences, so it's been as small as a single home.
As far as providing supportive services.
We provide supportive services in those facilities.
Okay.
We provide supportive services in individual apartments. You know, you could have a 100-unit complex, and we'll have 3 or 4 within that complex. We can do it as small as that.
And I know the agenda item is regarding your services to the cities of Ventura and Oxnard, but we are looking at other cities in the county, and so maybe we'll talk.
Would love to.
Yeah, thank you.
Would love to.
All right, Supervisor Zaragoza?
Yeah, Larry, thank you so much for that presentation. I think I was going to ask a question. You mentioned that in Oxnard, the 25 people or families that you place from the Armory, is that permanent?
It's permanent. We're talking permanent housing.
Permanent housing. That's fantastic. That was 25 out of the.
I want to be really clear, though, who gets credit for that, and that is your city. That is the city staff.
Is that Mark?
That's operating it.
Mark.
Yes, that's Mark and his team. I want to be really super clear about that. We're riding their coattails on that one.
Mark is saying yes.
He's like, okay.
A lot of people that are involved. That's great, you know, when we can place that many people, because I know at one time we had 100 people staying there at the Armory, 100, 125, and then, but to place 25 individuals and individuals, right? That is great. And thank you for your presentation.
Appreciate it.
I have a question there
Supervisor Huber.
relative to the east part of the county.
Yes, sir.
And when I say that, the 3 cities there most easterly would be Moore Park, Thousand Oaks, and Simi Valley. What type of a commitment are you making on that end of the county?
Right now, our focus, honestly, I'll be very direct, is with Ventura and Oxnard. Those are the cities that brought us in. Those are the cities that are working with us, and so our commitment really is to those 2 cities. I want to say that's not a closed door. We are happy to talk to any other city that wants to partner with us, and if I may use this as an opportunity to let you know, because sometimes in a county system we can become siloed or we can become competitive. That has not been our experience with the cities of Ventura or Oxnard. We are taking a regional approach. There's a lot of shared information. We understand that there's a lot of crossover between the 2 cities in terms of the populations we're serving. We really are functioning as a more singular entity. And really, sir, if I may just be so blunt, it is a matter of what is the political will in those cities and what are the resources that they're willing to make available, and we can have a conversation.
Good, thanks. You answered my question.
Any other questions? Mr. Powers.
I had one last question, Larry.
Sure.
In terms of permanent year-round shelter sizing, and Ventura is about 55 beds, is there sort of a minimum number of beds for what should make sense to operate from your standpoint?
I didn't miss it. Was it for shelter or for housing, did you say?
Shelter.
For shelter? I would say no. I don't think so. I don't know that I would go much smaller than what we're doing in Ventura, because, I mean, we can do whatever, you just don't get the cost efficiency. So it's really your appetite for inefficiency.
Thank you. And one of the things we'll do too is make sure that we connect you, and some of it's already happened with our social service department, and healthcare and behavioral health and so forth, because we really want to tie in with you in the cities.
Absolutely.
And thank you for coming. I saw you present at the City of Ventura, and I was just amazed at your level of knowledge and your candor. And so thank you for coming.
Thank you all very much.
Thank you very much.
Thank you, Larry.
Really appreciate that good work. Thank you very much for having that. All right, we're at our 10:45, item 53.
Motion to receive.
Oh, yeah, motion to receive and file. There we go.
Good morning, Chair Bennett, Board of Supervisors, CEO Powers. My name is Dr. Rachel Linares, and I work in the County Executive Office. I am here today to request your approval as a board for the CEO's office recommendation to align our continuity of government, our COG, and our continuity of operations plan, our COOP, with the approaches, practices, methods, and tactics that we have infused with our disaster recovery and response plans and programs. We've been through a lot in the last 18 months as a county with the Thomas, the Hill, the Woolsey, and the borderline shooting incidences. As we have been tested and our capacities tried and tested, we have also had a lot of great learnings that have happened within each of those incidences. We have worked to infuse those learnings within our disaster response activities as well as our disaster recovery plan. And it's our recommendation that we also infuse those items within the COG and the COOP. Now, the COG and the COOP were approved by your board back in November of 2008, but since that time, they have remained largely unchanged. We would like to recommend that we infuse these new learnings and try to make the COG and the COOP more agile, more nimble, more flexible, and more scalable so that they take a more all hazards approach that we have taken with the disaster response and recovery plans. So we are here today to request that your board approve the study and creation of recommended changes to the administrative manual, policy number and chapter 2-20, the continuity of government and the continuity of operations plan. And we propose that we come back to your board within 12 months with our recommendations for what needs to be updated within those specific documents. And I am happy to answer any questions that you might have.
Mr. Powers?
Thank you.
Got a comment?
Yeah, just real quick. Thank you, Dr. Linares, for leading this. Bottom line is it's an outdated plan, needs to be updated, but it's also big, frankly, sort of a narrative book. And what we learned is that doesn't work. You know, we need checklists, we need things to be rapid and flexible, and that's the way we want to align that, essentially, with what we're doing on our response and recovery.
All right. Any other questions? All right.
Move it.
Of course.
Ready for a motion and a second? We're ready to vote. Thank you very much.
Thank you.
All right, and we are, if I'm correct, we're just down to a closed session, correct? Will there be any announcements coming out of closed session?
Do not expect any announcements.
All right, thank you very much. We'll head into closed session.